partners on the implementation of projects designed to prevent and address human smuggling and trafficking, to promote the protection and integration of migrants, and to improve their access to basic and protection services as well as employment. The regional project East African Migration Route, the so-called EMR, is one of the many programs within this framework. It is a 10-year program consisting of multiple phases. It began in 2019, first with an inception phase, followed by phase 1, currently being implemented by Save the Children. The project is implemented in 3 countries, Ethiopia, Sudan, and Egypt, with a regional dimension that focuses on cross-border and route-based approach, as well as advocacy efforts at national, regional, and global level. EMR targets children under the age of 18 and youth up to the age of 24. It focuses on migrants and host communities. The main aim of the project is to contribute to better protection, provide livelihood opportunities, strengthen states and non-states actors to better respond to migrant and forcibly displaced children and youth, and address the risks of exploitation and violence. Finally, yet importantly, the project promotes adequate policies for children and youth along the migration route. This program builds on the strategic link between international cooperation and migration policy in a priority region. EMR has already achieved remarkable results. It is also proved to be timely in responding to the Sudanese emerging crisis. The project, within its various activities across the 3 countries, was able to realign towards reacting immediately and effectively at the very early stage of the conflict in Sudan, and continues to do so. Today's event marks another key milestone within the project. The data collected and presented today is dedicated to evidence-based programming for children and youth on the move. I would like to thank again MMC and Save the Children for coordinating the event, and looking forward to the different sessions and fruitful discussion. Over to you, Ayla. Thanks a lot, and really happy to be here today.
Thanks very much, Rita. We could imagine no better voice coming in through the speakers, and really introducing the project and what it means, and how Switzerland has made this endeavor possible. So yeah, I'd like take this microphone. Okay.
It doesn't fall down.
Good morning and welcome, everyone. My name is Laura Jepson. I'm the Regional Director for Programme Development, Quality and Impact for Save the Children's East and Southern Africa Regional Office. And I'm absolutely delighted to be here with you today on behalf of our Regional Director, who's currently in Mozambique, to give some opening remarks for this wonderful event. Much to echo Ida's comments, I have to say a few thank yous. Firstly and foremost, thank you to the donor, Swiss Agency for Development Cooperation, for supporting the East Africa Migration Routes project. Funding for regional projects that support the protection of migrant children is absolutely vital, and especially when it strengthens data and our understanding of this very vulnerable group. Of course, thank you to our wonderful partner, Mixed Migration Centre. Save the Children and MMC have a strong history of collaboration on generating much needed evidence and learning on children affected by migration across Africa. And indeed, MMC's expertise in high quality data and research on migrant decision-making, their experience of risks and vulnerabilities has uniquely placed them as a brilliant partner. And this was further enhanced by our common goal to make sure the voices of children and youth are brought into our research. Of course, thank you and well done to my Save the Children colleagues from our regional programming unit, who continue and remain dedicated and committed to ensuring effective and impactful programming for children and their rights, regardless of their status, and making them at the center of everything we do. As we mentioned, this is a 2-year partnership in the making, and the project was impacted by dramatic changes in the context, both the COVID pandemic, conflict in Tigray, and of course the conflict now in Sudan. However, this only further highlighted the importance and the dire need for strong, up-to-date evidence on displaced populations. Despite the challenges, a particular highlight was how the team were able to interview over 200 youth in Sudan, which presented a group where there was a significant knowledge gap in the response. Sadly, at least 1.85 million children in sub-Saharan Africa were left displaced by climatic shocks last year in 2022. Some of these children were displaced multiple times, and this number has almost doubled compared to 2021, and actually was the highest annual number of new displacements for climate disasters for the region so far. These figures lay bare the stark reality that the resilience and coping mechanisms of communities in this region are exhausted, and the rights of children are becoming eroded at an alarming rate. So now, more than ever, we must be striving to ensure the protection and build the self-reliance of children affected by displacement and migration. And we must ensure that migration policies and strategies are both inclusive, but also responsive to the unique needs and vulnerabilities of those children. Thank you all for joining us here today and online, and I wish you all a very successful event, and I hope we have many insightful and thought-provoking discussions together ahead. Thank you.
Thanks very much for your introductory remarks, Laura. So first of all, I would like to say it doesn't matter how long it's been since the pandemic. Whenever we endeavor to convene a hybrid event, there are always challenges. So I thank you all in advance for your patience as we navigate those. To give a bit of an introduction, my name is Ayla Bonfilio. I'm the regional head of the Mixed Migration Center based here in Nairobi, covering our Eastern and Southern Africa region, but also Egypt and Yemen. And what is MMC? MMC is a research institution that sits within the Danish Refugee Council. And our aim, or our overarching aim, is to collect empirical data and inform programming and policy. So I really want to welcome everyone and thank you also for those in the room who have made the journey, and thanks to those online for tuning in to really be here after what's been nearly a 2-year endeavor in terms of active project, but a far longer process, as Laura said, in terms of planning the East Africa Migration Routes Project. And this is really the culmination of nearly 24 months of research planning and data collection. And I'd like to thank once again Rita, who is the Migration and Protection Advisor at the Embassy of Switzerland. And as I said before, the focal point for the East Africa Migration Routes Project, without whose support this would not have been possible. And to Laura, who is the Regional Director for Program Development, Quality and Impact for Eastern and Southern Africa at Save the Children, for introductory remarks, and really the whole SAVE team who's here in the room today. Fortunately, there's too many to go through, but who've all been a part of the process over the last several months. And so happy to have also colleagues from SAVE from country offices here, and you'll hear from them throughout the day and also online. So as Laura said, what's MMC's role been in this project? Because this project is much larger than MMC. I mean, what we're not seeing here, but what actually was discussed last week at SAVE's learning event is a pretty large scale 3-country project aimed at children and youth on the move. And MMC, our role is really as the main research partner within that project. And it's grown out of the recognition that there is a dearth in empirical data focused on children and youth on the move who are actively on their way out of East Africa, transiting countries like Sudan, and some who are headed north. And this gap stems from the greater time, the investments, and the sensitivities involved in carrying out data collection with children and youth in a way that's suitably sensitive and ethical, and also given their invisibility along routes when adults are so often the focus. So with this in mind, MMC's task was an ambitious one to help develop this evidence base, and in the process to develop tools with SAVE, but also other partners that were ethical, that did no harm, and that picked up on the particular experiences and vulnerabilities of children, youth, and their caregivers. The overarching aim, of course, was to generate contextual evidence that could inform policy actors and programming and complement EAMR data related to monitoring and evaluation and programming assessments. So with this contextual base that MMC was providing, coupled with the meal and program assessment data, that it would really be this larger root-based and evidence-based program. And I think MMC was perfectly placed to fill that role as this more contextual research partner because of our 4MI project, which is this flagship data collection project that carries out survey-based data collection with refugees and migrants. And uniquely, it's through direct interviews often by refugees and migrants themselves, who are situated in key points along migration routes. So when the opportunity to participate in the EAMR project arose, we had to think, how do we adapt this large-scale data collection architecture that's aimed at adults to make it suitably sensitive to focus on issues that are key to children and youth. Also recognizing that maybe a survey tool is not the most sensitive tool for carrying out research with children. And so what we did was we developed, first and foremost, a whole new sampling criteria, looking at how we could focus in on youth, but then also who we call caregivers, but they're adults traveling with children in their care, and also maintain a small portion of our sample dedicated to single adults so that we could have some kind of comparison group. And to ask these three groups also about the experiences of children, their knowledge of risks, and complement that with more qualitative data, so more sensitive data collection tool for working directly with children. And so together we built this more child-sensitive data collection approach. And then in terms of what we added to our survey, we developed these particular modules. One developed on youth and their specific experiences. One, when we identified someone as a caregiver, that showed the different kind of considerations that caregivers would have on the move when they're moving with children and where they identified spaces of risk. And these you'll see come up in the presentations today. So some key figures before we get started. So by the time the project finishes at the end of December, or at least this phase 1 of the project, we'll have collected just shy of 3,000 surveys. So 2,877 surveys. And this is across Sudan and Ethiopia. In Sudan, it will be approximately 1,500, and in Ethiopia, 1,377. Youth represent 50% of that sample, while caregivers are approximately 30%, and the rest are single adults as 20% as that comparison group that I mentioned earlier. All of these data are going into a dashboard that my colleagues today on the panel will walk you through. And just once again to reiterate that as much as possible, the data are collected with refugees and other migrants, but uniquely by refugees and other migrants. So then in terms of the products that you can expect to have at your disposal to inform your programming and work, I mentioned this large scale dashboard. If you are interested in using it, let us know. We will send you unique login credentials because we can't just put it online as is. It's quite detailed. And we can also, of course, arrange sessions on how best to manipulate the data within it. But you'll get a taste of that today through each of the panel sessions. Then we have a qualitative study that's been carried out by our colleague Niklas in the room on stranded and returned Ethiopian children in Metema in Ethiopia. And this study really came out of a need directly voiced by the Save the Children country office to look at this unique group that was not covered by our 4MI survey that will be presented this afternoon. And we have a series of 4 snapshots, 2 of which are already online, on refugee and migrant youth in Ethiopia, their access to income, protection concerns and needs, caregivers and children on the move in Ethiopia. Soon we'll be publishing a snapshot on the impact of the Sudan conflict on movement decision-making in and out of Sudan. And then fourth, another snapshot focused on the impacts of the Sudan conflict, but really zooming in on those movements coming into Ethiopia. And that will be online soon, also before the end of the year. So all of those will be at the disposal, but of course, there's always more data than what we can use for publications. So I really encourage you to approach us if there's extra data that you're interested in or particular disaggregations. So I'll walk you through, with the remaining time, a little bit about the program that we have today. So we have three panels, the first of which this morning is on protection risks and abuses of children and youth on the move. The second panel will be after lunch, focused on drivers and onward movement intentions of children and youth on the move. And for our colleagues who are tuning in online, you'll have a lunch break between 12 and 1:30 Nairobi time. Then we'll take 20 minutes break for coffee after our second panel and start up at 3:20. And this third panel will be on the unique experiences of caregivers on the one hand, and on the other of unaccompanied and separated children and youth on the move. And then I'm really happy that we can conclude today with a keynote from Dr. Abeba Minaye on really looking forward. So really thinking what should our migration research outlook be for children and youth on the move, given, as Laura mentioned, how much, and as Rita mentioned, this region has been shifting just over the last 15 months alone. And throughout all of these, we really invite everyone to take an active role in participating, sharing your own work, even if you're not a panelist, and the implications of what the research and the data might mean for your work. We want this as much as possible to be an active discussion. So a little bit of housekeeping, because it's a packed schedule and we want to have sufficient time for breaks and for discussions. We will be keeping quite strict time. We have a colleague in the front, Jim, who's going to be holding up cards if you're a speaker to let you know when you have 5 minutes left, 2 minutes left, and then 0 when you're out of time. And then whoever is moderating will give you a polite suggestion to wrap it up. Because we have limited space here at the front, if you're speaking, you'll be here at the podium where I am. And if when you're not and you're just listening to your fellow panelists, you can stay in your seat. And then once all the three panelists of a session are done, I would invite them to come up here, and then we'll have more of a curated and open discussion. You'll see we do have the coffee breaks in the schedule. They'll be had out here. There are also toilets outside for those of you in the room. We have cocktails. If you're able to persist with us through the whole day, that will be through the blue door. Please do stay for that. And I think those are the main points. The event is being recorded. We're also going to make an edited video with the help of our AMP studios in the back, so that you can see some of the key messages and outcomes following it. But if you have any issues with your image, let them know. Feel free to tweet during the event. This is not a Chatham House style event, but if there is something that you are saying that's a bit more sensitive, just say it for the room. And I think we can have this strategy of being a little bit flexible but careful with each other. And so, okay, without further ado, I'd like to introduce the first panel. We're pretty well on time. And with that, I will introduce our esteemed moderator, Rhoda Kasimbo, who's the regional program manager for Save the Children, and who's also a fellow member of the MRP with me. Rhoda, thank you very much.
Thank you. Thank you very much, Ailia. Without taking much time, allow me to introduce the team that is going to be speaking in the next couple of minutes. we've actually been introduced to the rules of the game, that you have a number of minutes, and then when you are done, you'll be allowed to sit down. We are also going to encourage, we will have some time to be able to have some discussions. So we encourage that you take time to listen to the presentation, take notes, and engage with the panelists. So just before I do that, allow me to be very inward looking and recognize the presence of one of our directors who has actually been very, very supportive and provided the environment, a favorable environment for this research to be able to move on very well with MMC. So Gregor, just a minute for you to introduce yourself.
All right, I don't know if I should, do I need to come to the front to be in the picture? Yeah, I'm very aware there's a camera. Yes, thanks a lot. Thanks a lot to the MMC. Obviously also to the SDC, and thanks a lot to Rita for joining online, which isn't always easy. Yeah, I think I'm just happy to see this coming together and this kind of coming to the point where there's, I guess, a lot of data and evidence that is starting to come out and that is starting to also not just exist, but also kind of be pushed out to the audiences that who it's, I guess, ideally meant for. And I think I was like children, particularly children, but children on move in general, on the move, are kind of this odd group where 90% of the time when talking about data, they're mentioned in the phrase, we don't have any, or we have big gaps, and we don't actually know the scale. And it kind of feels like being asked how many grains of sand in a bucket, and you're just allowed to look at the palm of your hand. Like we don't know a lot about children. So I think this, I was interviewed earlier, and in my head, I just felt like actually if by the end of this partnership, we're not going to complete the picture. We're not going to have all the puzzle pieces. But if everyone walks away and feels actually there's a few pieces that we've kind of added to this, and we kind of feel value in that and motivated to kind of keep adding more, then I think this was a big success as a partnership to me. So yeah, so I'll wrap it up there. Thanks a lot again, and I'll hand back.
Thank you, Gregor. Just to mention that Gregor spent a lot of time making sure that this research, even when we had a number of unfavorable environment, especially with the, some conflict in the regions that we were doing the research, he was always available to provide support and advice to MMC. Thank you very much. So I'd like to get to the panelists. And may I introduce the first panelist, who is Lavina. Lavina is a project manager, MMC, who's going to be talking to us about the protection risk and abuse on children and youth on the move. We also have additional panelists. One of them will be joining the next group, but we also have Elena Garibaldi from UNICEF, who is a migration data and reporting consultant, will be joining us after Lavin. So welcome, Lavin. A big, Tanya is here. Okay, sorry. Welcome. Tanya will also be joining us after Lavina. And Tanya is coming from Norwegian Refugee Council, Regional Protection Coordinator, who is also going to be speaking in the first set of the panelists. So welcome, Lavina. A big hand for Lavina.
Give me 1 second to get the presentation up.
I think while we wait for the tech at the front to be sorted, we're not too many in the room. So I'm wondering if we want to all introduce ourselves, name and affiliation. That way also the people online can have a sense of who we are. And then we all know each other before we go into the coffee break. Shall we start with the back table? And I think there's a roving mic we can give you.
Hello. Yes, hello everyone. I am Rebecca Christensen, and I work as a PM for Altai Consulting, mainly on the EUTF.
Hi, everyone. Hi, everyone. My name is Michael. I'm the MRP reporting officer based here in Nairobi with IOM.
Hello, everyone. I'm Darasa Daniel, working for Mixed Migration Center based in Ethiopia, Addis Ababa.
Hello, everyone. I'm Masi Wangeshi. I'm a graphic designer.
Hello, everyone. Good morning. My name is Tessie Benjamin, and I work as a consultant with Altai Consulting.
Good morning. My name is Golocha Boru, and I'm an intern with MMC.
Good morning, everybody. Naitori Gituma with Terre des Hommes Netherlands, Advocacy and Influencing.
Good morning. My name is Fozia Mohammed from the National Registration Bureau. Thank you.
Good morning, everyone. My name is Anne Ngugi. I'm a fingerprint officer with National Registration Bureau and also a student of migration studies at the University of Nairobi. It's a pleasure to be here.
Good morning, everyone. My name is Mary Mweni, Regional Emergency Coordinator for Eastern Southern Africa, working with LWF, Lutheran World Federation. Thank you.
Good morning, everyone. I'm Gloria Maina, Research and Learning Specialist, Save the Children International. Pleasure to be here. Thank you.
Annie Tamsabeni from the Danish Refugee Council, Borderlands area.
Good morning. My name's Kennedy Sargo. I'm a UNHCR Protection Officer with a focus on mixed movement.
Good morning. My name is Joseph Mwangi.
I serve at MMC.
Rhoda Kasimbu, Save the Children.
Good morning, everyone. My name is Elena Garibaldi, and I work for UNICEF in the regional office in Nairobi.
Good morning. I'm Ababa from Addis Ababa University, and I'm the chair of the Forced Displacement and Migration Studies Center at Addis Ababa University.
Good morning. My name is Manusha Josefi, and I'm known as well as Mimi. Rhoda, hi. I'm Community-Based Protection Officer working with UNHCR in the Regional Bureau, and mainly focusing on telling the real story, which is communication and engaging with communities in mixed movement.
Hi, everyone. My name is Asma Taha from Save the Children Sudan. I'm the project manager for the EMR project implementation in Sudan.
Good morning, everyone. I'm Jim von Worsel. I'm the research specialist with MMC Eastern and Southern Africa.
Good morning. This is Niklas Meyer, a researcher and consultant on migration, climate change, and development based in Ethiopia. Thank you.
Let's go again.
Hi, good morning. I'm Tanya Marcello, the Regional Protection Advisor with NRC.
Hello, I'm Daniel from IOM, working with ETM.
Hi, everyone. My name is Lavina. I'm the Forum IPM with MMC, and hopefully we'll be able to start now. Great. Can everyone hear me? Or should I use the handheld mic? Can you hear me in the back? Okay, fantastic. So as Rhoda mentioned, I will discuss the protection, risk, perceptions, and experiences of children and youth on the move that we have researched on under this project. Next slide. And again, as Isla mentioned, so all of our data for Ethiopia, we have about 1,377 surveys collected. The breakdown is about 50% men and women, 50% youth, 30% caregivers, which was our goal. And in terms of nationality, we had seen 49% of Eritreans, 38% South Sudanese, and 7% Kenyans. Interestingly, in Ethiopia, you also see that about 55% are refugees. We have far fewer migrants that are of undocumented status. In Sudan, we're still collecting data, and currently we have 1,180 surveys done. Again, the breakdown at 50-50 men and women, 50% youth, 30% caregivers. A lot more diversity in the respondents. So as you can see there, we have Ethiopians, Eritreans, people from CAR, Chad, Nigeria, and South Sudan. And in terms of pre-conflict and post the outbreak of the conflict, we had 576 surveys collected beforehand and 604 after. And here we see that 47% were undocumented, so they had no legal documents to stay in country. Next slide. Thank you. Notably, the most commonly cited dangerous locations of all respondents in Ethiopia was the Hitsats refugee camp, followed primarily by locations in South Sudan and Sudan. For respondents in Ethiopia, the locations didn't massively change before and after the conflict, which of course makes sense. And when you pull out specific nationalities, so when we look specifically at South Sudanese, we see then that the dangerous locations shift primarily to South Sudan and Sudan as they're transiting on their way to Ethiopia. On the other hand, for Eritreans, we see that the top 4 dangerous locations are all in Ethiopia and not in transit. Next slide. So looking at the perception of abuses in the dangerous locations mentioned before, We see that both men and women identified physical violence as the most common risk in these dangerous locations, and then death and robbery. Additionally, women do cite higher rates of injury and ill health, and both men and women did perceive sexual violence. When looking at the top 3 dangerous locations from the previous slide, we actually see that physical violence and robbery are most cited in the refugee camp, between 62 to 72% for both men and women. But when you pull out the locations in South Sudan that are in the top 3 most dangerous, physical violence and robbery jump up to 86 to 94% as a perceived risk, and risk of death was perceived by all the respondents in Latjor, South Sudan as a risk on their journey. Interestingly, if you break this out by nationality of respondents and look at Eritreans, we see that detention moves up into the top 3 at 44%, and South Sudanese report the risk of death at 94%, and physical violence at 91%, and robbery at 86%. And when we look at youth, when we disaggregate by youth, we see across the top 5 locations, it stays about the same, although death did go up very slightly and robbery also very slightly, but still the top 3 as physical violence, death, and robbery as perceived risks. Basically, what this really tells us is that that people are perceiving multiple risks in every location, and it emphasizes how precarious their journeys really are as they're moving. Next slide. Perfect. So we also ask about the perpetrators of abuse in these dangerous locations that they list. Overall, respondents interviewed in Ethiopia cite that the risks were most likely to be perpetrated by armed groups and militias, followed by criminal gangs and the military or police. This doesn't vary largely by gender. We see about the same, except that men do feel criminal gangs are more likely to perpetrate at 47% versus 38% of women. And again, when we disaggregate by youth specifically, there's again not much difference in the top 3, but armed groups jump up a bit to 69%, then criminal gangs at 49%, and then military and police at 33%. However, where it is more notable is when we break it out by nationality. So Eritreans cite military and police at 50%, armed groups at 39%, and then people from the local community at 35%. So it may have negative implications for reporting abuses, right? Interestingly, also South Sudanese follow the same top 3 breakdown as above, but armed groups jumped up to 84% for South Sudanese on their journey, and smugglers weren't featured very highly across any group. Of concern, military and police and local community members being among the top 4 has negative implications for reporting, but also how the community perceives migrants along their journey. Next slide. So looking at the abuses that migrants have experienced in Ethiopia, or of respondents in Ethiopia, over half of both men and women had experienced robbery, and 56% of men had also experienced physical violence. Also, over half the men witnessed death along their journey. And this stayed about the same when disaggregating by youth. There wasn't much difference. The main coping mechanism that people cited to protect themselves from abuse and crime was to travel in large groups and to avoid large cities on their journey. Again, if we break this out by nationality, Eritreans list robbery still as the #1 experience, then physical violence, but then detention with men at 33% and women at 15%. For South Sudanese, the top 3 remained the same, but witnessing death shot up to 80% for men and 77% for women. Next slide. So now we will look at Sudan as our data out of Sudan. Since the outbreak of conflict, Khartoum became the most dangerous location for respondents in Sudan. Before the conflict, the top 5 dangerous locations were in Eritrea, Ethiopia, Libya, and Chad. And respondents were primarily listing locations in their country of origin, especially Eritreans, before the conflict. Some respondents were also identifying locations along the route. So people from CAR were identifying Chad as the most dangerous location, and people from Chad were identifying Libya and CAR pre-conflict. Sudan was considered safer than other places. Since the outbreak, of course, Khartoum jumps up to number 1, especially though for migrants from KAR and Ethiopia. And Eritreans were still listing locations in Eritrea as their top 5 most dangerous locations post-conflict. Again, when disaggregating by youth, the data stays about the same. Next slide. So looking at the types of abuse that respondents were perceiving on their journey in Sudan. So the top 3 risks stayed about the same across both genders, so robbery, detention, and physical violence. Men did list detention slightly higher than women, and interestingly, the top 3 risks stay the same after the conflict among all respondents. So it didn't change before and after. And again, very little difference when we pull out youth specifically. However, notably, when we look by nationality, especially Ethiopians, bribery and extortion goes up to 81%. It's quite a big jump. And then robbery and physical violence were in the top 3. Eritreans cited the main risks as detention at 67%, then robbery at 65%, and bribery at 64% pre-conflict. Post-conflict, bribery is the number 1 response, followed by physical violence and robbery. Next slide. So respondents in Sudan cited criminal gangs, armed groups of militia, and military or police were the most likely perpetrators of these abuses along their journeys. The 3 groups remained the same after the conflict as well, so there was not much variation, though we see the military and police jump up a little bit to 64%, and criminal gangs dropped very slightly to 67%. Again, not a massive difference with youth when we disaggregate by youth. However, before the conflict, youth had criminal gangs at 83%. So that was more of a concern pre-conflict than post. Notably, when we pull out Ethiopians only who cited dangerous locations, they actually said military and police at 82%, followed by armed groups. And their top 2 dangerous locations were Humera and Metema, so kind of tracks with where they're moving along. Eritreans said the number 1 group to commit the crimes were actually border guards at 73%. So again, the fact that it's military, police, and border guards are among the top 4, we won't receive as much reporting, and will have negative implications for reporting these abuses. Smugglers also, interestingly, were much higher here than we saw in respondents in Ethiopia. Next slide. So these 2 graphs show the experiences of abuse among respondents interviewed in Sudan pre-conflict and post-conflict. They were asked whether they personally experienced or witnessed abuse, and their experiences were as high as perceptions. So the experiences varied very slightly pre and post-conflict. We see detention being higher pre-conflict and dropping a bit post-conflict, but physical violence increases since the start of the conflict. Notably, it also makes sense, of course, that witnessing death will have increased post-conflict. In terms of youth pre-conflict, they cited robbery slightly higher at 85 to 86%, and detention for young women before the conflict was also quite high at 76%. Post-conflict, youth experiences stayed about the same as what you see in this graph here. And again, the coping mechanism was traveling in a group, but also using a safer method of transport. So less concern about avoiding large cities here. And one thing to note here, when you pull out Ethiopians specifically, bribery and extortion goes up to 83% for both genders, followed by robbery. So quite high for Ethiopians. Next slide. So this is a question that we asked specifically to caregivers, so people traveling with children in their care in both Ethiopia and Sudan. We asked them on the perceived risks that they have for children under 18. We see that 62% say it's physical violence, followed by injury, ill health, and death. Of those who said that there are these risks for children, 62% say they've been very highly exposed to these risks, and another 27% said they were highly exposed. So nearly 90% of children have been exposed to these risks. There was no difference when you break it out by Ethiopia versus respondents in Sudan. And pre and post conflict, the risk stayed relatively the same. The death, of course, increased very slightly. So some recommendations that come out of the data. Oh, sorry, next slide. Thank you. Some recommendations that are coming out of the data that we've collected. We would recommend increasing protection and monitoring services along the route, especially in transit hubs, border crossing, and refugee camps, specifically the Hitsats refugee camp in Ethiopia. Locations of early transit are rife with abuses. So people do, mention these abuses pretty early on in their journey and during the rest. The data suggests an increase in precarity since the outbreak in conflict, especially around physical violence and death. So we see that with respondents in Sudan. And actors charged with safety and security are perceived as key perpetrators of these abuses. So it makes reporting these crimes quite challenging. And we should feed this data on risk to actors that are working on awareness raising in communities of origin on the risk along the journey of these migrants. And most importantly, probably conducting sensitivity training with both local communities and military and police to try to reduce some of these abuses that migrants are experiencing. That's all from me. Thank you.
Thank you very much, Lavina. Let's give Lavina another one. So let's warm it up. Warm it up. So we do a warm up, and then we give a kamoja. We call it kamoja in Kenya, okay? Warm up, kamoja. Thank you very much. Thank you, Lavina. So I would like to request that please take notes and your comments. Keep writing them down. We'll have some session to be discussing that. Allow me to invite now Tanya Marcelo from NRC.
Good morning, everybody. I don't have a presentation, but I wore a colorful shirt to capture your attention. So there we go. The focus of what I'm going to be speaking about is more on the situation in Sudan. NRC has quite a big presence there, so I think it's the one that I can sort of speak to the most effectively. And I think that it has really affected all demographics of people, the crisis in Sudan, as sort of came out through the data. Prior to the conflict, it was one of the largest refugee population, hosted one of the largest refugee populations in the region. And it's also a key origin location. So the context there, and I think that the protection risks facing children are really significant for all of our work because of the sort of consequences beyond that. So I guess just to put a bit of perspective on it, according to IOM's most recent DTM data, they say there's an estimated 4.9 million people who have been internally displaced and 1.36 million people have crossed into neighboring countries. It is estimated to be 53% children, so 3.3 million children are affected by the crisis, which is the highest number of displaced children globally. So it's a significant crisis in our region. From NRC side, we're working in 5 states. So we're in Jazeera, Gedaref, White Nile, South Kordofan, and we've recently re-entered into West Darfur. We're also working with emergency rooms in Khartoum and in the Greater Darfur region. So my sort of reflections here come from this sort of base. And we have 3 streams of protection work. So we're doing general protection activities, legal protection through our information counseling and legal assistance program, and also with the Better Learning program, which is a psychosocial support program for children embedded in our education programming. So I guess just sort of speaking broadly on the main protection risks, which is what I'll be focusing on. One of the key ones is the lack of respect for IHL and the attacks that we're seeing on civilians and unlawful killings. As came out through the data, the threat of physical violence and death is significant. And it seems from the conduct of hostilities that the principles of distinction and proportionality are really not respected. In Khartoum in particular, we've seen such widespread attacks. And also the level of contamination in UXOs longer term is going to have a significant impact, which we know affects children disproportionately. There's also been many reports of targeted killings. This has affected adolescent youth in particular. Recently in Janina, in Arzamata, an area there, in the beginning of November, there was about an estimated 800 to 1,300 people that were killed, which included adolescent children, adolescent boys who were perceived to be a risk of fighting age. There's been a number of grave violations reported, including maiming of children, GBV, attacks on hospitals, and abductions. So the situation from an IHL perspective, the protection of civilians perspective is quite dire. From a GBV perspective as well, there's been, as was mentioned, the sort of collapse of the state and the rule of law has led to a lot of these impacts. There's been a lot of reports of GBV and sexual violence. There's also been an increased number of checkpoints reported, both formal and informal, which have significantly impacted people on the move. And so there's been a lot of attacks reported at these locations and also heightened risks of GBV. And then also we've had a lot of reports of child separation and the risk of recruitment and trafficking that emerges through that. So it's estimated by the Protection Cluster that 3% of children are separated from their primary caregiver, which based on the extrapolation is about 100,000 children. And even in areas that are deemed to be sort of safe, so in SAF-controlled areas, there's been a lot of reports of detention and interrogation and disappearance of children, of adolescents, because of perceived affiliation with the RSF. So they really are sort of stuck between a rock and a hard place. There's a high risk of abduction of children for recruitment and also sexual slavery. On the 15th of September, it was reported by the SAF that they detained 30 minors fighting with the RSF. Having said that, it's on both sides. There are reports of children fighting on both sides. The mental health impact has been really significant through our Better Learning program. We have been working closely with children who are displaced for PSS support. There's been a real sort of urge amongst this population to reconnect and restore normalcy. Separated children are the ones who are really struggling the most, and many have reported witnessing death of their family members. When we recently ran an evaluation on the program, they were very confronted when we were going through some of the stories. They were very confronted by ones that address separation, isolation, loneliness, drifting, and abandonment. So these are really the sort of things that were the most triggering for these populations. And then sort of to that point, the ability to restore normalcy is also limited because of the closure of schools. So we have 19 million children who are outside of school. Having said that, though, it's a very complex situation because it's coming into conflict with other protection risks, because there's a risk of forced eviction. At the moment in Gedaref, for example, 94% of the gathering sites are schools. So the thing that a lot of humanitarians are negotiating at the moment is that balance, how to balance the need for children to return to a learning environment. But at the same time, it does affect them because their family members are affected by the risk of forced eviction, which in SAF-controlled areas affects approximately 180,000 people. So that's one of the sort of tensions. And then finally, on the school closure point, there's also a lot of uncertainty as to the ability to register because many people lost their documentation. So birth certificates are needed for that registration. And at the moment, it's not clear as to whether people will be able to attend school now that a lot of people have lost their documents. So unfortunately, it's not painting a great picture. It's quite a dire situation for children of all demographics in Sudan. On top of that, there is the risk of disease and malnutrition, which is affecting the population quite significantly. So I just wanted to provide a few remarks on what we're seeing in terms of the protection environment in country. We're also facing a lot of challenges with funding. The funding is not necessarily equivalent to the level of the crisis that we're seeing. And I really can't understate the access challenges. We really are having a lot of bureaucratic challenges with the HAC and other sort of governmental bodies. So there has been a lot of challenges there, particularly when it comes to providing services that need confidentiality. There has been a lot of oversight from the government in some of those situations, meaning we can't always support people as effectively as we'd like to. So that's just a few reflections from my side. Thank you so much.
very much. So just remember that you have to warm it up, 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 warm it up. Let's give it kamoja, kamoja. Thank you very much. Thank you, Tanya. So we will actually move again to the next presenter and then we'll have some time to engage. So may I request Elena from UNICEF? Welcome. Thank you.
I have a presentation. And let's see if I can control it with this magic pen. So good morning, everyone. While the presentation is, okay, perfect, it's there. So I'm Elena Garibaldi. I work as migration data reporting consultant with UNICEF within the child protection team of the regional office, which is the Eastern and Southern Africa regional office. So, no. Next slide, please. I start with contextualizing a bit what UNICEF does. UNICEF has a global program framework on children on the move, which declines 6 asks into programmatic responses. Okay, it's not visualizing well, but is about protecting children from violence and exploitation while moving, ending the detention of children, keeping families together, and give children access to legal status, help children accessing school, healthcare, and other essential services throughout their movements, address the root causes of movements, and combat discrimination against children on the move. Next slide. So in this framework, next slide, please. What? I keep speaking because the time is running. But yes, in this framework, in our regional office, which covers 21 countries from the Eastern and Southern Africa, UNICEF we follow a system strengthening approach with a focus on the inclusion of children on the move in national systems and the continuum of care for those who move across borders. So this provides the opportunity to support the protection and the development of children in mixed movements and to address specific challenges across the challenges they face in the country of origin, transit, and destination. So now we go to the second slide. Yes. So we are working on 3 main pillars: multi-sectoral and multi-country programming. At the moment, we have 2 multi-country and multi-regional programming in the region, one covering 8 countries in the Eastern and MENA region. For our region is Uganda, Kenya, and Ethiopia. And another program founded by you is covering Zambia and Southern Africa, South Africa, but also a couple of countries in Latin America region. So why children on the move are vulnerable? This is the first question to ask when assessing the risks. Because they are children, of course, but also because, as colleagues said already, they are often invisible in data and evidence, and therefore there is a lack of child-focused policies and services that create some substantial risk for them. And also because immigration systems and border protection services and structures are not adequately prepared to guarantee just and fair protection for children in their best interest. Next slide. So UNICEF conducted a study, was published in 2021. So MMC study is much more fresh than this one, but asking children, learning from children and young people on the move, their experience about migration. It was done with interviews on about 1,300 children and young people in Ethiopia, Somalia, and Sudan. And these reports help addressing the evidence gaps in the Horn of Africa by providing an understanding on their protective environment, their access to services and resources, and their perception of safety, well-being, and trust
in authorities and partners along the way. Next slide. These are the key research questions. So why do children and young people move? In their own words, what are the risks, harms, and vulnerability they encounter, and what is their perceived experience, and are child protection systems and services enough, sufficiently effective and accessible? Next slide. The sample, as I mentioned, included interviews with 300 children, 37% between 14 and 17 years, and 63% between 18 and 24 years. This sampling is more or less homogeneous across the 3 countries, and it was complemented by qualitative interviews. Among the respondents in different research sites, and there were also supplementary data from Egypt. Among the respondents, we have 44 Ethiopians, 21 Somali children, and 14% of Eritrean, 10% Sudanese, and 5% South Sudanese. Next slide, please. We talk about risk and opportunities because the report confirms that migration experience is complex and is perceived by respondents as having both positive and negative impacts. So children and the young people are willing sometimes to take significant risks to pursue the opportunity that migration offers them. And therefore, it's important to keep both opportunities and risks when assessing what is the best interest of a child. Next slide. So said that, children on the move are, as said by other colleagues, as known, at risk of some of the worst forms of abuse and harm along their journey, particularly those who move irregularly, unaccompanied or separated, are at heightened risk of abuse, trafficking, unsafe means of transportation, and kidnapping. At the same time, they often lack access to services and to essential services. Gender plays an important role in the migration drivers, but also along the journey. And experiences of children between males and females were very similar across the risks they expressed, but there were some differences across the type of risk, and as well access to service. For example, physical violence and detention was more likely to happen to boys, while girls felt scared. A higher percentage of girls felt scared or used as smuggler. Just to make a note that this survey didn't ask respondents about sexual and gender-based violence due to ethical reasons. And now you may wonder why crossing an international border is in this slide as a risk. Next slide. Because not only 70% of respondents crossed an international border, but most of them reported that their experience at borders were particularly negative. Less than half felt that the border as crossed was safe, and the large majority spoke about loneliness. But what is striking here is that 70% or more found it a place where authorities or other person are not supporting as per needs. Next slide. Okay, the physical violence is another risk, of course, as highlighted by Lavina in the presentation. And being physically hurt or experience trauma over a period, including witnessing death, in particular, can have a very severe physical and mental consequence, as also Tanya was highlighting the mental health of children. 1 in 4 respondents felt they were negatively, so experienced some kind of discrimination. Next slide. About detention. About 30% of respondents experience detention or deprivation of liberty, and particularly lack of identity documents increased the risk of detention in countries that treat irregular migration as a crime, even with minors. Next slide. And about smuggling, smuggling resulted to be the third most likely source to help in planning for the journey after family and friends networks. But the research didn't ask about the use of smuggler at all points of the journey, just at the beginning, but it was clear that some children or young people started without the help of smuggler, but then decided that the service was needed in order to move further. Access to basic service. Also, I will say a few words here because it's important when looking at the risks and the services for children on the move. So generally it's poor and the needs are unmet. By the nature of movement, children and young people are less familiar with their surroundings, and the services, if they are able to access the services, are already overstretched. So the main barriers are cost, location, the exclusions based on language, lack of the identity documents. And interestingly, the trust in authorities and services resulted to be quite low. Also, girls access service a bit less than boys. I will conclude with some key message. So the next slide, please. The first message is about investing in reliable, accessible, and timely data and evidence, because this helps not only to understand the needs of children on the move, but also to program on an evidence-based way and adjust policies, structures, and frameworks to their need. And evidence still remains, as colleagues said, there are growing efforts, but still huge gaps. And fostering the participation of children on the move, of course, with the necessary ethical process, privacy and sensitivity protocols in data and evidence helps having a multidimensional understanding of their experience and not necessarily always perceived as negative. Secondly, they need to strategize more with partners to get states' political commitment to protect children on the move, to ensure their rights across the borders, and to advocate for safe, orderly, and regular migration. And finally, investing in inclusive child protection system strengthening, including capacity building, including expanding the social service workforce, which has a huge gaps in the country's focus, investing in child-focused policies and services, and fostering cross-border collaboration between immigration authorities and child protection authorities. Thank you for your attention.
Tanya, again, Brigitte, warm it up for her. Warm up. Nice one for her. Amoja, thank you very much. So we will be looking at basically the country offices that have also been engaged in the research. And we just want to have a lesson from one of the country offices that were actually for this meeting. So I will invite Asma from Sudan and a few reflections, and then we can engage on this.
So hi everyone. So I'll be reflecting from the EMR experience in dealing with migrants and refugees in Sudan. First, I would like to reflect on the movement dynamics, not only for the migrants and refugee population in Sudan, but also in the current IDP crisis that is happening within the countries. As my colleague from NRC mentioned that there is around 4.9 newly internally displaced and 1.3 who have undergone cross-border movement. So we're looking at numbers of 6.3 million that has been forcibly displaced within the past 7 months, and reflecting also on IOM DTM that within the IDB caseload for October, if the numbers have steadily grown at the same rate, we're looking at 150,000 displaced persons per week, which is very alarming when you look at the protection environment, the protection risk, and all of that. I want to reflect on two, maybe protection risks. First is the recruitment of adolescents and minors into armed groups and armed forces. We know that within one of the RSF, for example, their ability to mobilize from West Africa, it's very easy. We're looking at increased numbers of minors and adolescents being recruited. Additionally, when we look at also the smuggling and trafficking dynamics, we recently got some reports from one of the security actors that the trafficking and the smuggling activities have not stopped, rather increased. The only thing that have changed is that they're now avoiding Khartoum as one of the key points within the smuggling and trafficking routes. So there is increased numbers of trafficking and smuggling across Sudan. And also it is not only about migrants and refugee population, but now when we're looking at the challenges in getting, for example, security permits and clearances to enter Egypt or one of the other neighboring countries, we have seen increased numbers of Sudanese nationals taking the smuggling route towards Egypt. So those are my two reflections. Also, I wanted to add on the accessibility to services. We currently witness a huge gap when it comes to the service mapping for referrals and service provision. There are limited numbers of actors providing services, especially within the protection. Also reflecting on the SGBV incident, we're witnessing that because we're providing protection and livelihood services. So within our case management services, we're witnessing an increased number of adolescent girls and youth accessing case management services who are survivors of GBV or SGBV. The current dynamics of the conflict have really affected the protection services, the livelihood income, but we're also seeing an increased trend of discrimination, maybe, and hate speech toward migrants and refugees. For example, we're looking at the displaced migrants and refugees to Jazeera State, which is the neighboring state to Khartoum. We look at after 1 month of the conflict, the government of that state took a decision to transport all the migrants to another location and mainly putting them in camp setting. So we're looking at dynamics of forcible relocation and also immobility. So currently when dealing with the government and engaging with the stakeholders, we're kind of restricted to provide aid services for migrants and refugees in the urban setting unless they move into certain camps. One thing I also wanted to highlight that when we look at the dynamics of migrants and refugee population within Sudan, we're looking at a complex set of migrants and refugees. For example, working in Gadaref state, which is the eastern corridor for Sudan, mainly having most of the migrants and refugees from East Africa crossing through Gadaref and then through Khartoum or any other part of the country. We're looking at a complex situation of protracted refugees, maybe from the Ethiopian-Eritrea war. We're looking at refugees from the recent Tigray conflict. We're looking at seasonal migrants at large numbers, maybe 200,000 or 300,000, and newly displaced population. So when you look at it for Sudan, it's very complex. Currently, the response for both the IDP and refugee situation is kind of limited. So we're looking at increased efforts and advocacy to be able to address all these protection challenges. Thank you so much.
Thank you very much, Asma. So Asma is actually sharing real life experience from Sudan. At some point, we were not sure about Asma, but good to see that she's been able to reflect together with the MNC data that we are also reflecting on. Allow me to request all the panelists to come to the front, including Asma. And this is, we have an opportunity to engage on some question and answer. Please take a seat, the panelists. So we are going to be giving everyone an opportunity to engage with any reflection and question and answer. We have some mics. We can give them some mics. So we'll open the floor for discussions. I'm sure you've been taking notes of the comments, the data. So this is the time for you to engage with the panelists. So feel free to engage. Any questions? Yes, and we have the chat box. Please feel free to, any questions from the chat box yet? Okay. Yes, Alia.
Thank you very much for the insights, but I will focus on the last presentation because it attracted my attention on the current situation in Sudan and how are the humanitarian organizations at this point functioning. I mean, part of the area could be under the opposition force, or even, sorry if I have messed with the naming given, RSF, the government force. How are they coordinating their activities with that situation? Thank you.
Thank you. Actually, most of the humanitarian actors and organizations have been affected severely by the conflict because it imposed loss of resources, huge loss of resources, especially within the current RSF-controlled area, which is mainly Khartoum, where mainly all of the headquarters of the organizations, UN, which mainly were looted. So even if you look at the NGOs and UN, there is a huge loss of resources. Also the staff, there is a huge displacement that has happened within that. So it's kind of easy to operate within the SAF-controlled area, which is the Sudanese Armed Forces, but humanitarian actors are trying their best also to reach the controlled areas that are under control of the RSF, as, for example, my colleague here from NRC said, working with emergency rooms, or for example, extending the support to Darfur through Chad. So it's mainly about assessing the situation regularly and then adapting to that situation. But the context, the operation context has been very challenging, to be honest. And it kind of was this regular context update and honestly a huge commitment from the humanitarian actors to be able to deliver. Thank you.
Yeah, thank you. Just sort of seconding my colleagues' comments. I do think that it's a big challenge for us to access the RSF locations. So there is a huge congregation of humanitarian actors on the SAF side. There's efforts through outreach with emergency rooms, as was mentioned, and then the cross-border from Chad. Having said that, though, the cross-border from Chad does present its own challenges because the RSF is seeking control of Darfur to strengthen their negotiation position and for sort of longer-term intentions. And so the extent to which we have to be cautious of instrumentalizing aid and showing that locations are safe to return to. For example, in Janina, there was reports that the RSF was preventing people from fleeing to Chad in the most recent violence at the beginning of November because of a message around it being safe. So we do need to be, I think, very cautious when it comes to re-entering some of these locations. So.
Thank you. Mine is threefold. First, I think it was very interesting in the remarks by Ella to note that having surveys targeting children and youth is quite it's quite a difficult process because children may not be able to respond in the way that is structured. And it's interesting to note that this was acknowledged in the surveys, and it would have been interesting to see the variance between the caregivers and those adults who may have tried to make the move or made the move in the mixed movement web to see what were the intentions. Was it the caregivers who made the decision to move with the children or the youth, or the children themselves, or particularly the youth, because they are capable of moving to make that decision, which is quite interesting because later on when I'm going to present, you'll see the numbers that we have up north in Europe, how many youths are coming through all the way to making the dangerous route, to see the variance between the two. And the second one is on how open were they to, especially for the refugees, to say that I'm a refugee in Sudan from Eritrea during the conflict, because it would be very interesting, because what we are seeing is a bit different. They are trying to use all methods to protect themselves. And sometimes stating that they are refugees makes them more and more vulnerable, especially when passing through, especially the Eritreans, when they were caught up in Sudan and had to go all the way to Kassala. And the only way to get out of the situation was to go back to their countries. So some of them were hiding their identities to try to protect themselves, which I think it would be interesting to see if that was analyzed. Yeah. And the last is on the response in Sudan itself, on targeting those who may have been faced with the risk of trafficking and smuggling. If that was, that I know that we have partners in Sudan who are trying to see how to rescue those who are caught up in potential trafficking and smuggling. Thank you.
Yeah, sure. So sorry, on the first question, I think Joseph will actually show you the data when we describe the dashboard. So we can show you how we pull that out. And then in terms of stating they were refugees, so that is one of the first questions that we ask in the survey as a part of the sampling criteria, because we don't do interviews with IDPs. So we do ask where they're coming from, what their intentions are. And if they don't state it, it's obviously not in there. So I think in general, we didn't have people that were necessarily hiding that information, but that is a good point that of course they may do that for protection concerns. And the last question on trafficking, was that for me? I think it's for her, yeah.
Thank you. So identifying victims of trafficking and smuggling, maybe it's like the most challenge to identify. So we mainly rely on outreach work. Like we mainly invest on working with outreach teams, community mobilizers from the targeted community. Then when we develop that trust with that community, then it's easier to be able to identify those who are being trafficked or smuggled. And honestly, at the early stages, they might come at you just accessing services, protection or livelihood. Then maybe later on, engaging with that child or youth, then you might find that he or she is a victim of trafficking or smuggling. So the way for us, for Save the Children, which has been very successful, is to invest in outreach work as much as you can, and also to build kind of a trust between the targeted community and the organization. Also, this requires working with more of a safeguarding and conflict sensitivity approaches. Yeah, like working with migrants and refugees, both of those communities requires putting safeguarding measures first and then conflict sensitivity. Thank you, if this answers your question.
Just another round. Let me see if I answer. And once wonderful. Then Mimi.
Thank you so much. So I have like, well, 2 or 3 questions. I'm not sure. I think the second presentation the second was Asma and Tanya. So the first one was around the presentation around the statistics. So maybe my question is premature in regards to data, but what element of child sexual exploitation besides SGBV violations, what aspects stood out of exploiting children besides child labor, but sexually. I would really be interested in that because of the vulnerability of the child exposed. And from the recommendations by, I think, still ASMA, there's one that stood out for me, that 60% would rather rely on CBOs, CSOs, and family rather than government. You know, what might, because I mean, the government being initial duty bearers to citizenry, where is there the lack of trust, and what needs to be done to ensure complementarity? Because reliance on NGOs entirely for government services of protection really is a big gap that cannot be fulfilled by CSOs. And also, there was unregistered children, which is 30%, I think. What steps are done, or do you have the, what is it called? Linkage, referral mechanisms to have these children registered, or do you pass them, I don't know if it's to IOM or UNHCR, how is that done? Those are my 3 questions. Thank you.
Mine was also a slight reflection and question. So I think what's kind of amazing is that you can do 10 different research projects and come up with 10 different findings. But what I've seen just from the panelists this morning is actually quite a lot of consistency and agreement in the data, whether it's our 2 very large data sets or it's consistency between field level observations and experiences with the data, which means that we have the potential to really make some strong recommendations, whether it's around, you know, Lavina had the slide where we showed 70 identified locations of early transit, like risk in early transit locations, the huge number of perceptions around protection abuses that children are exposed to, and then actually what you're seeing on the ground with respect to forced recruitment. So for me, the key takeaways coming out on what we need to be maybe looking at are on forced recruitment in particular as a key trend that's going to stick around, that we need to understand better and the consequences of it. But also thinking about, okay, if we know that smuggling dynamics and trafficking dynamics are persisting, which comes through across all of our work, then how do we see how conflict potentially is transforming those dynamics? I think is another key thing that's coming out. And then a practical question, of course, it's on HACC. And I wonder, Tanya, it's for you, whether you could say a little bit of a few words on how the dynamics with HACC, with being in the field, also with collecting data and information has changed pre and post conflict, because we already saw before April 15th, moving closer and closer towards these quite harsh restrictions, if we could call them that. And so what's happening now?
So we want to take the responses and then we
So on the question on child sex violence, we do have the option of forced marriage as one of the options for answering, and we actually see it at less than 5% in the data, so quite low when it's asked if there is a risk of forced marriage, both in Sudan and Ethiopia. However, youth do flag the sexual violence in general quite high in Sudan at 58% and 23% in Ethiopia. So there is the risk of it, but we go into more details in the qualitative work, which I will pass back to Ayla to explain.
Thanks, Lavina. So I would say that for these more sensitive questions, for the same reason that UNICEF doesn't really delve into them with survey questions, surveys are really blunt instruments, and these kinds of questions really require qualitative inquiry. And so we've carried out around 26 in-depth direct interviews with children under the age of 18, over the age of 14, and 6 focus group discussions that are around 7 to 10 children each. And through those are where we see more dynamics emerge. And among some of the female respondents, of course, it's not representative, but quite a number have expressed child marriage or escaping marriage dynamics, but also interpersonal violence. So violence within their families that they're experiencing as a reason for their movement. And so the migration strategy is actually quite an agentive one, or one that shows their agency in escaping these violent dynamics. And so it's an independent migration decision that's made for them to remove themselves from those dynamics when they're able to do that.
Yeah, so on the question related to referrals and why do we rely most likely on NGOs or CBOs, it's mainly due to two factors, which is the capacity gap of the government stakeholders to be able to provide services. And this is according to a capacity building needs assessment have done in the AMR project, which highlighted that there is no active referral system for the government. There is a capacity of MHPSS, lack of MHPSS, and case management. So those are the first factor. The second factor is resources. The government of Sudan has a very big challenge with resources, especially that when we look at the conflict dynamics, we look at that civil servants have not received their salaries for almost the past 7 months. So there is no, like, you can't ask them for the commitment or even accessing like the institutions. For the registration, for refugees, it's easy to refer to the Commissioner for Refugees, the government body responsible for dealing with refugees issues, or for UNHCR. When it comes to migrants, it's a bit sensitive. So we mainly kind of provide a link between the migrant population and the Immigration and Police Department for those who would like to access documentation. But also when we look at documentation, there is many restrictions when it comes to that. For example, the protracted refugee caseload, their children doesn't have access to documentation, only for birth registration. But this imposes like immobility and other challenges for them to access services as well. So this is the question related to registration. And I think Ayla had a question on HAC. You know that the Humanitarian Aid Commissioner, the government body responsible for coordinating all the humanitarian work in the country, has imposed many challenges like through the years on humanitarian work. But when we look now at the dynamics post the conflict, the restrictions rather increased. And now we as NGOs have to deal sometimes with security forces directly. We didn't have to go through that before, but now we have to engage with like additional security persons directly, including sometimes submitting our national IDs to be able to move or to access our population of concern. Thank you.
Sorry, just to sort of feed into that too. Again, I also was quite interested to see the sort of verification that was ongoing there in terms of what we're seeing and what's being reported. So that was very promising, I think. I guess from my side, I think that we can try and maybe work closer together on programmatic recommendations. I think that that's something that often I don't necessarily feel that, I guess, yeah, that's sort of a bit of a gap in some situations. And I guess from NRC side, I will say that it is focused on IDP populations, but ideas around prevention of so we call it civilian self-protection, and the way in which we can identify and map and work with local communities that are doing things that are self-protective behaviors. It was very interesting to hear the coping mechanisms that you mentioned around traveling in groups, avoiding urban environments. And so I think that that's something that perhaps that's something that can really come out of a lot of this research, which would be very promising. From the HAC point of view, I guess, yeah, just echoing my colleagues' views on this as well. It's interesting because in West Darfur, what I'm hearing is that they're more cooperative than they were in the past. That's sort of very specific to the dynamics, I guess. But I will say that I can reflect on this from a position of protection programming, and usually even my job title is enough to get me struck off visa application lists. So I think that my colleagues in other sectors have had a bit more, it's still not been easy. It's still been sort of an ongoing sort of test of patience. But I will say that, so our team re-entering in Madani in particular is having quite a lot of challenges where they were getting sort of followed and question when there was data collection, they were sort of very active, or like when there was sort of just initial meetings in terms of re-entry into some of the gathering sites, they were followed, and there was a lot of active involvement of the government in the questions that were being asked, like why do you need to know that kind of thing. So again, I'm not understating, I really don't want to understate the access challenges, they are significant, but the teams are sort of like making progress, I think, and that's with the caveat that protection's always got extra scrutiny. So yeah.
Thank you very much. Online team? No, there's one. Yeah.
Okay, thank you. No, just quickly, it's more a reflection, a comment in support to the one of the recommendations, actually, Lavinia, that you showed us in terms of awareness raising with communities, but as well targeted groups on the risk of journey. Actually, the initiatives that I'm coordinating in the region is exactly that. Telling the real story, which is engaging with communities and communicating with communities on the risks of journey. One lesson learned, or one element that I think is very important and is good as well to try how to add it, is that in order to increase effectiveness of this awareness raising, it's very important to associate the information about the risk of journey with information regarding protection services, available for protection services, our other assistance, opportunities, education, economic opportunities, as well as alternatives to irregular migration routes, for example, legal pathways or other types of pathways. In UNHCR, we call them alternative pathways, to give a holistic picture on what are the opportunities and how to look for those opportunities, how to inform them about the opportunities. It seems it doesn't work only raising awareness on the risks. Another element that look to be quite important is as well along the routes increase or strengthen or inform as well children and youth on the move in terms of local opportunities, right? Once youth and children are on the move, how can I say, are they going to go back? No, yes. So how are we able to give them some opportunities to somehow make them think and decide that, okay, let me stop here for a while and let me see how how else and how more productive I can use the resources that I have, a little of resources that I have, etc. So how able we are as humanitarian actors to provide protection and solutions at the earliest stage of the journey of the movement. I think this is very important, but as well in terms of, and sorry, I don't want to take too much time, in terms of awareness raising within the communities or with target groups, and we have seen that mainly the youth are moving a lot, is as well to have this hope-based approach, dialogue and conversations with children and young people to see how, right, they can take an informed decision based on opportunities as well that they have. Beck, thanks.
Thank you very much. Not sure that Nicholas, you still have your question? Yeah. Yes, let me see how many more questions we have. And Jim, you are taking care of our time. How are we doing?
We're gonna be a bit over time because you have to present it actually.
Okay. Do we take another round? Okay. Okay. So we take, let me see your answer. We take like 3 more, and then we have 1 on the chat, isn't it? Okay. So over to Nicholas.
Yeah, thank you so much. I have one question for Elena regarding your recommendation, strengthening inclusive child protection systems. If you could elaborate further how exactly you would see that happening and what would make those child protection systems inclusive, and how the collaboration between different countries, regional organizations, international community could be improved from your point of view. And for Lavina, I was wondering if you had information regarding the Ethiopians and Eritreans that you surveyed in Sudan. Regarding the Ethiopians in Sudan, if you have information from which regions of Ethiopia they were mainly coming, and about the Eritreans, if you know if most of them came and stayed a long time in Ethiopia before going on to Sudan, or what their kind of migration journey was. Thank you.
Mine is to find out if you're able to identify the differences on the protection risks and abuses for these children and youth, both on the formal borders and the informal borders, because the dynamics are very, very different.
Thank you. My reaction will go to Lavina. There's an issue you raised about the military and police and the local community members who features at the top 4 who are perpetrators. That is quite sad, because those are the people that we tend to rely to offer protection to the children who are migrants, or maybe to the youths. I don't know how we can move around that, but you're left maybe at a corner where we have little or maybe no help. My second question will go to Elena. When you raise the issue of 80% of children crossing an international borders, taking into consideration that you have the formal and the informal borders, does that mean that our borders are quite porous and the agencies working around those borders are, maybe for a lack of a better comment, careless enough to let these kids cross to another country? That is my question. Thank you.
Yes. Sorry, I was just balancing both microphones. Yes, the question is for Asma from Shonia M. Thank you very much, Shonia, for your question in the chat. Asma mentioned that in Sudan, there's ability to mobilize from West Africa recruits into the conflict. Also, there is increased discrimination towards refugees and migrants. I'm wondering whether these two issues are related. What is triggering increased discrimination and hate speech in Sudan? Thanks.
Yeah, we allow them to respond. So, do you want to start? Yeah, can I start? Sure.
Hello. So Nicholas, with regards to your question, again, we'll show it on the dashboard. We have the breakdown of the regions they're coming from, etc. With Ethiopians in Sudan, we have about 49% that are coming from Tigray and 23% from Amhara regions. And then with the question on Eritreans and how long they're staying, I think we can pull that out of the dashboard and share it with you directly. I don't have the data right in front of me. And then the second question on military and police and local communities. One thing to note, this is a perception of risk question. It's still important because people are reporting that they're perceiving this. And I know there are a few agencies that work directly with training police and military members. So IOM does this, UNODC does this, and they focus a lot on human rights abuses and how police can prevent that, right? So I think agencies that do those sorts of training, if we could share this data on what migrants are experiencing and help expand those trainings to also include migrants and not just other populations, I think that's possibly one recommendation to change the abuses going forward.
Okay, thank you. So I start from the question on system strengthening, and thanks for this question. So let's start to understand what's the system, what what is included in the system. So it's made by resources, by actors, by legal frameworks, policy frameworks, by procedures. And in order to have an inclusive child protection system, then we have different pieces of the puzzles to put in place, which relates to all of this. So having stakeholders in place at different levels, state actors, international organizations, CSOs, religious leaders, all persons involved in the provision of services for children in migration, the capacity they have, and the instruments and mechanisms they have to collaborate. So I was saying in the presentation that it's key to invest in capacities, to invest in national social workforce strengthening, because there is a huge gaps in all the countries, and in these regions particularly. There is a lack of child-focused policies and legal frameworks that sees the child as a child regardless there is the immigration status. So ensuring that children rights do not stop at borders, ensuring that at border points there is a cross-border collaboration between states, between actors, that immigration officers are either trained in child-focused processes or are in strict touch with the child protection authorities so that they can provide services for children who wants to cross and move. I think these are the key elements. Yes, what UNICEF does is supporting these pieces in improving legal frameworks, improving strengthening the capacities of the actors, and investing in cross-border collaboration mechanisms, standard operating procedures, and the guidelines for frontline workers. And as we are talking about borders, so thanks for the question. So the interviews took place at border points also, not only in urban areas, in refugee settings, at border points, official border points, with a snowball sampling methods. So it didn't capture, of course, all the experiences of children that may cross informal border points, and of course, borders are porous. And again, looking at the picture, how to protect all the children that wants to cross international borders. First of all, advocating for safe, orderly, and regular migration pathways, and also providing services, strengthening the services provision along the borders and not only at the official border points. This is my comment. Thank you.
Thank you for the question. I'm not really sure. I think this is a question that needs further investigation. We can clearly see from social media there is a hate speech towards the ethnic groups from West Africa that are being mobilized for the conflict in Sudan. But also when you look at the discrimination, for example, that happened in the Jazeera state, it was against migrants and refugees from Ethiopia and Eritrea. While also looking at the case of South Sudanese, they have better chances in being resident in the urban setting, or even to be able to move across the country. It's for them, it's an easy case. If you look at a totally different case of refugees from Syria and Yemen, those also have better chances. So it needs kind of further investigation and evidence on what's creating this. But if you look at the different nationalities of migrants and refugees, you realize that there is like a different treatment when it comes from the government or either from the population. Thank you.
Thank you very much. I guess we are running short of time, and really want to appreciate the opportunity and the engagement we have had from the panelists. I guess as different organizations seated in the room, we've learned a lot, and we can relate to a number of programming initiatives that we want to be looking at using this data. We can relate to advocacy initiatives that we would want to engage on using this data. I want to encourage all of us to take away some of these reflections and ensure that we are actually going to be champions of the programming initiatives and advocacy initiatives ahead of us. So we want to give them another round of applause. So warm it up again, warm it up again, warm it up, warm it up. Then we are going to flower, we give them a flower. And when I say kamoja, then we give them kamoja. Kamoja, kamoja. Thank you very much. Thank you. So I'll hand over to Alia, who is the direction of the work.
So this marks the end of our first panel. So for those of you who are tuning in, we are going to start again at 1:30 Nairobi time, PM, right after lunch. And I think we'll be able to start promptly. And for those of us in the room, we have lunch. The lunch is served downstairs. Yes. And we have colleagues in the room who will help you find it. So again, thanks very much for a great morning session.
Small businesses are determined and always planning their next move. It's easy with GoDaddy's domain search tool. No wonder so
If you do any kind of writing, you need to check out this AI tool. It's called Quillbot, and it made me a better, faster, and smarter writer. Their paraphraser tool will help you rewrite your sentence, paragraph, essay, or article. All you have to do is enter your text into the input box, and Quillbot can make your writing 10 times better. The best part, you can try it for free on quillbot.com or take it anywhere with our free Chrome extension. Try Quillbot's suite of AI-powered writing tools today.
Penny is looking for the perfect domain name deal. That's why she needs Namecheap. There are hundreds of domain extensions available, spanning all types of interests and industries, all at great prices. With
You're such a rush, my baby, slow down, come find your love. I'm hoping you see me, come serve it up. Loving when you stir it up, that body belong on TV. Oh, this feeling I can't hide. You're feeling up my mind, and I just don't know why.
Grammarly's 5 tips for writing a professional email.
Email writing is super important. That's why I'm going to break down everything you need to know for your next important email. Tip number 1, think positive. Sending an email that sounds negative or even neutral can be off-putting. Tip number 2, strike the right tone. Grammarly's tone detector, a must-have feature for email writing, can help with this too. Tip number 3, follow up in the right amount of time. A follow-up message should never come.
Meet Gabe in Nairobi. He ships from the USA to Kenya with Kentex Cargo using a Delaware address. With a Delaware address, his purchases in the USA are not subject to
Yeah, buddy. Buddy. Wake up. Wake up. Wake up.
Who's ready to hatch some cool pets? Click here to make your
Spike needs to launch his bold new delivery business online without costs going sky high. He'll need this and Namecheap because he wants a domain that'll really take off. The perfect website and reliable web hosting, security and privacy features that'll stop anything, plus extra services and tools.
Small businesses are determined and always planning their next move. It's easy with GoDaddy's domain search tool. No wonder so many customers trust us with their domains. Get your domain with GoDaddy today.
So if you're not the best or fastest writer, you have to check out this AI. Quillbot has a 6-in-1 AI-powered writing tool that has been helping over 50 million writers worldwide. All I have to do was enter my text into the input box, and Quillbot's paraphraser made my writing 10 times better. And they even have tools like grammar check. Never make a mistake again. You can try Quillbot's most powerful tools for free. Give it a try today.
Okay. Welcome back, everyone. I think we are exactly on time. Are we connected to those in the Zoom? Can I get a thumbs up in the back from our tech team if it's true? Yeah. Okay. Wonderful. Okay, so I hope everyone had a good lunch and is caffeinated and is ready to go. I know, as Rhoda just reminded us, the post-lunch slot is the toughest. I will not lead you through an excruciating icebreaker, but I will trust that we are ready to go. So this second panel departs a bit from protection, which is really front and center of this project and the project's data. Here, we're really delving into, with panel 2, drivers, onward movement intentions, routes, these kind of migration dynamics, to really try and understand what might be unique or additional about children and youth migration decision-making and dynamics, and to really understand the considerations that are made along the route. So I will just introduce the panelists now, all in one go, just to give you an overview. So our first, I think out of popular demand, we're going to be giving you an overview of the dashboard, looking at some of those data points that were raised in the first session that we didn't have time for. Joseph's going to do a demo. Then we'll get right into one of the first, we'll have Kennedy from UNHCR as our first speaker. He's a mixed movement coordinator with the Regional Bureau. Then we will have Daniel Campos, who's a DTM analyst at the Regional Data Hub at IOM. And then we'll close in a kind of reversal of what we did this morning with Joseph Mwangi, our Information Management Officer at MMC, walking us through the actual data. So without further ado, Joseph, can I invite you to the front to give us a long-awaited demo of our dashboard? Now, I'll just repeat once again that for anyone who's interested in using it, whether it's online or here in the room, please let us know. We can have a login, a unique login made for you so that you can use it as part of your work. We just ask that you follow up with us, tell us how you use it to inform your programming so we can understand, or triangulate it with your existing data, just so we can really track the impact. Over to you.
Thank you so much, Ayla. So real quickly, I'm going to take you through the dashboard. And I'm going to highlight a few findings reflecting the questions that have been asked in the first panel. So here we have our very beautiful dashboard that we have developed from the data we have collected in Sudan and in Ethiopia, a total of 2,557 respondents, and we're hoping that this is going to grow by the end of the year to reflect the additional data that we're going to collect in Sudan. So this is the first page that you see with a very beautiful map showing where our respondents have been interviewed and the areas of origin or locations where they're originating from. And you can see that the respondents or the origins of the respondents quite diverse, running from a few from West Africa, Central Africa, and crossing all the way to Yemen. So real quickly, there was a question that was asked about the origins of Ethiopians interviewed in Sudan, and you can get this information from the dashboard. And what you can see is once you click on the profile section here, you will be represented, or you will see different charts showing the profiles and demographics of our respondents. And this beautiful map again here you're seeing reflects the origins where these migrants reported to have originated from. So zooming in. So again, similar to the other map that you have just seen, you can see the different locations where they're coming from, and the bubble represents the size of the respondents that we interviewed and that cited that they had come from those regions. So how you can interact with this is by, you can zoom in, as you can see me doing this. So what you do is you have a filter on the left side where you can filter by country of interview, and I'm going to do this and filter Sudan because we're interested in seeing respondents from Ethiopia that were interviewed in Sudan, and filter the nationality as Ethiopia. And what happens is that all the charts on that page are going to change to reflect that filter that you have put in place. And what you can see is that a majority of the respondents are coming from Tigray, 190, followed by Amhara. So approximately 49% and 24%, if I'm not wrong, of our respondents are coming from northern Ethiopia. And I hope that answers Nikla's question. Yeah. The other section, or the other question that this can be used to answer is refugees, the profile or the proportion of refugees and migrants coming from Eritrea. So here you have a button at the bottom that you can use to clear the filter, as I'm going to do right now. And what will happen is that the graph will be reset. So first I'll speak to the overall migration or legal status reported by our respondents. And as you can see, 40% self-identified as refugees, and then 60% identified as irregular migrants, asylum seekers, and a very small proportion as temporary residents with permanent visas or permits. So here, again, I will filter by nationality, Eritrea. And you can see more than half of our Eritrean respondents self-identified as refugees. You can go ahead like we did before and see where they are from or where they were interviewed. In Ethiopia, a higher proportion than in Sudan, as you can see here. 74% self-identified as refugees. And in Sudan, here is where you see more than half, which is a complete contrast from what you have just seen in Ethiopia, self-identified as irregular migrants. And then the other proportion, asylum seekers and refugees. So I will also show a few additional pages. One being direct experience. You can get so many insights from this dashboard. You have drivers, intention, perception of risks, assistance, smuggling, some of the data that we have here and insights. You're not going to present in this forum, but they can be really helpful. So I'm going to talk about or highlight direct experiences. So my colleague Lavina talked about the coping mechanism of most of our respondents. And you can see the additional coping mechanisms that were cited here. Sorry about that. So traveling in a group, looking for information, planning the journey carefully, and so on. And then you can use the filters once again to filter by location and disaggregate the data further if you want. Something else like I would also like to highlight is this filter here, especially for the people interested in the data from Sudan. So we have data collected before the conflict and data collected after the conflict. And if you're interested in comparing the two, you can use this slider to slide back, like I'm doing right now, to before the conflict. And obviously, you'll have filtered Sudan up here. And you'll see what are the experiences of respondents they're talking about like the direct experiences of our respondents before the conflict, and then you can do the same and view the direct experiences after the conflict and see whether there is any change. I think that's it. So then something that I think, and we feel like most of you might also be interested in, is looking at access to assistance. So this particular page here talks about what kind of assistance did they receive along the journey, which locations they needed assistance the most and did not receive, and what kind of additional assistance they needed. So I think you're going to have an easy time accessing the dashboard, interacting with it, and we look forward to getting requests from you to access it. And we are willing and available to support you in any way that we can. Thank you so much.
Kennedy, can I please invite you? And do you have slides? Can we make sure that they're put on the screen? Question. Do we have a roving?
Bribing the smuggler. What does that mean? Can anybody explain? I don't know. Yeah, that drew quite my attention.
All right. I'm going to try and pull it so that I can speak on that. Or do you have it? 0%, right? Do you want to talk about it? Yeah.
We didn't get any, I think, data points for this, but what it was originally, I think it's at 0. Yeah. But what it came up in a kind of focus group of what kinds of strategies could people undertake, and whether it was paying your smuggler more to ensure that you're on a safe route, or to help you, let's say, get out of detention if they're working with certain officials. So it's the sort of preferential treatment along routes. Of course, bribing has this separate connotation because they're already paying services of a smuggler, but this is more what it was referring to.
If we are still waiting for the PowerPoint, I think it's very interesting as well for us, and I will be in contact with you to see how as well to have access to this research as well in terms of tips, safety tips. We are a little bit working within this telling the real story and engagement with communities along the route. Actually, we're trying to see again and again and to see how to adapt the safety tips. And I think those coping mechanisms that were there could help us as well to tailor and to see what could be really a safety tip. I don't know. I remember when I was working in South Asia, actually, I think IOM had a phone number that, if you have to move, we advise you not to move, right? But if you decide to move and you really want to move and you have your reasons to do so, this is a phone number. If you find yourself in this location, yeah, you can call this number. These little safety tips are important as well. Thanks. I think the PowerPoint is ready.
Thank you, Mimi,
Over to you, Kennedy.
for that break. And thank you, Ayla, for the flexibility to have my presentation precedes Joseph's. Just understanding from what Joseph presented in terms of the dashboard, I think I would have had a better presentation if I knew where to get that information. But I think Joseph will come and take it on the statistics. But my presentation is really about the outlook of the situation of onward movers and onward and mixed movement in our remit, that is the East and Horn of Africa and Great Lakes region for UNHCR, and to really display the state of play in terms of mixed movement and onward movement, and drawing really richly from your experiences to make it more interactive rather than me sharing what I don't know most of the time. So from the analysis and from the trends that we've been able to capture, at least from the countries that we have a focus on as UNHCR, looking at the map, you can't see it, but we have three main routes that we are really trying to see how our officers are able to first detect if a refugee from Sudan, an Ethiopian refugee is registered in Sudan, moves into Eritrea. We use biometrics to be able to follow this through, to know that these refugees are crossed over into a new territory and are seeking what? Either whatever form, either assistance, or they have made a choice and moved to that country. So that's what we call onward movement. And this is, you see it internally here amongst countries. For example, DRC to South Sudan, Ethiopia to Uganda, Uganda to Kenya, Tanzania to Kenya. And we would want to understand, why do refugees move from one territory to another? Since the primary aim of protection, seeking asylum is protection. If anyone can go for that, why would they want to move? Why would a refugee in Uganda from DRC move from Uganda to Kenya? Any reason? Anyone? Anyone with a loud voice? Anyone? Mimi? No, as a precursor.
One reason could be deterioration of the protection environment. Denial to access asylum, lack of documentation, lack of registration, definitely the reduction of food assistance has been recently one of the reasons, or drivers, we call them drivers of movement. Legal status, access to services, family dynamics as well, violence, domestic violence. Youth don't feel that they have enough opportunities for their growth, access to economic opportunities, education as well. Let me go back to access to education. The refugees that see that the quality of schools is not good enough. The perception of receiving more assistance in another country of asylum. Yeah, anybody can help?
Yeah, your neighbor? Yes, please.
Everyone one point.
Beba.
When relations among countries get tense, the refugees also would get it difficult for them to stay where they were, and then they need to move to a different country when they think there will be better support.
Yeah.
Yeah, I think my point would link to that. I was going to say maybe the non-acceptance of these refugees by the host community, or discrimination, xenophobia. In other words, no long-term integration, right? Like no prospects in the long term to stay in that country.
Thank you. I think this table has most of the answers, not all. If you, any other, but generally, just like individuals, refugees are mobile, and sometimes they have valid reasons. And one of the reasons, I think Mimi described quite a catalog of reasons. And one of the reasons as well is for the asylum seekers. If they wait for too long for the asylum determination to be lodged and be finalized. And we are seeing this especially in particular countries. And I can give an example of Ethiopians in Somalia. Yeah. Eritreans in some parts, because sometimes governments want to take time to assess their asylum claim. And you can imagine if a refugee has lodged a claim for 14 years, what are the prospects? And what you are seeing quite recently, as Mimi said, is assistance. As I think it was a colleague from NRC has indicated, refugees are also trying to gauge which country is offering more assistance. And a good example is in Uganda, when there was a reduction of food aid to close to, I think, less than 40%. We saw a big wave of refugees coming from Uganda to Kenya. And now we have close to 9,000 in Kakuma. Some were returned, but now it's becoming more and more challenging. And we are seeing these movements between countries. And a good classical example is in Sudan, where we had the 15th of April refugees who had to leave the country for obvious reasons because of the conflict. So they sought asylum where either they went to South Sudan, and as Asma said, some even went to Egypt, but when they were faced with challenges of at the time, they were required to have permits to be able to cross into Egypt, because at the time, there was no, at the moment, there's some flexibility, but at the moment, at that time, they had to have a permit to be able to enter, to be registered as any alien. The issue of LGBTQI, you all know what's happening in the region. We are seeing more and more of these individuals who have lodged the application, but especially the East African member states, unfriendly laws, and one of which is in Uganda. So anyone who had a claim in Uganda as an LGBTQI would want to what? Seek protection in an environment that would enable that application to proceed. So there are very many reasons why, and that's why we depict that internally we are seeing more and more onward movements amongst the East Horn of Africa and Great Lakes region. And in terms of those who leave the country and try to go further outside the region, and we call them mixed movement amongst the migrants, we have three routes which we focus on. We have the eastern route, which is through Somalia, Ethiopia, and most of the migrants and refugees end up in Kingdom of Saudi Arabia. And this IOM focuses more on this, and they do very well because they have also ability to be able to track their movements all the way to Yemen. We only stop in Djibouti, but we have quite a number of individuals who pass through this very the territory of Somalia, Ethiopia, and Djibouti all the way to Saudi Arabia. Then the northern route, which UNHCR has a little bit of inclination in terms of the focus from our office in Tunis and Italy, is the northern route from Eastern Horn of Africa through Sudan, sometimes through Libya, across to the central Mediterranean, all the way to Europe, which we see more and more advancements in this route, as I'll display shortly, especially in the countries that have been fractured with the conflict in Sudan and parts of Ethiopia. Then we have one other route, which is not very prominent among even us as partners and actors, which UNHCR still has a way to monitor, and that is the southern route, all the way from Horn of Africa, passing through where we are today in Kenya, with an aim to reach Tanzania, and I'm informed they go all the way again up to Egypt. I mean, up to, not Egypt, up to the southern part of the territories. So just as an example of the central Mediterranean route, since our focus has been on the drivers, on why people would want to move, as you see, just to depict the situation of those who have been able to disembark in Italy in 2023 and in 2022. Just to note, this is just from January to July. So you can see the top countries that are still featuring are Eritrea, Sudan, Ethiopia, South Sudan, Somalia. Why are these numbers so high? I'm sure you have answers to this. Eritrea, for example. Yeah?
Well, I don't have an answer to this, but I think we're also looking at the state of the state. It might be good to clarify that these are not among the nationalities derived. Oh, sorry. Just to say, from what we've been seeing, these are not among the main nationalities to arrive in Italy, right?
Yeah.
So maybe just like a disclaimer that, okay, the numbers are there, but when you put them in perspective, these are just my 2 cents to add in here. I wouldn't have an answer to say why are they high, why are they low, but I think if we look at the overall statistics, we see bigger increases in West Africans going to Italy, people from Tunisia, Egypt, etc.
This is just from East Africa, from the region. Oh, yes, that's true. Yes, that's true. That's very true. The numbers are higher in especially West Africa, all the way to the Mediterranean, but within the region here, if we can just look at the nationalities in question. Yes, Beba.
I think partly is colonial connection. And second, there's what we say chain migration. Usually when it is started in one road, that builds up. For example, in Ethiopia, Nicholas is very keen to it. The southern people in Ethiopia are moving downwards towards South Africa because it started at one time and then the network grows and develops. That way, Eritreans have a very strong network in Italy than I definitely know compared to Ethiopia and Somalia. So that network is the other reason for more Eritreans to be in Italy.
Thank you, Beba, for that very interesting analogy. Just to give you a hint, if you're an 18-year-old male in Eritrea, what would happen to you if you reach the age of 18? Yeah? So we see more and more youths and children making this dangerous journey, especially when they reach that prime age where they feel that the only thing that will happen is what? Forced conscription. Now, moving on to the other category, Sudan. I think we all know why this trend is higher, but interestingly, as Asma said, even before the conflict, still Sudan, we had a really huge trend of individuals. As you see, the second in 2022, there was no conflict then, but there is a trend of youths and adolescents moving from Sudan. What would be the general reason? Again, because you are talking about drivers. I'm looking at Asma. I'm sorry to put you on the spot. Yes. So the prices of fuel, you saw what happened during the before even the conflict, the events that happened before the conflict as well, and how youths and adolescents were becoming more and more desperate. And it goes on, and it can cut across the board. I think this reason cuts across the board for South Sudan and Somalia. And for Somalia, because of the efforts to where they are now, it has not been easy. The socio-economic situation has not favored youths and adolescents staying in Somalia. So moving on, and I was assisted here by the captured snapshot by the 4MI. And if you see the assessment that was done, I think in 2022, if I'm not mistaken, on the 4MI, in Sudan, the top preferred destinations were Canada, Australia, Belgium, in that order. So already from the analysis, it shows that people had a preferred destination in the past study that was done by the snapshot, which the dashboard has indicated. And in Ethiopia, again, the preferred destinations were Canada, Europe, and the US. So that I would say is, in a nutshell, what could be the drivers for this kind of movement. But just to say, as you said, Jim, that in Africa generally, we are seeing a trend of really the socioeconomic situation really decaying to the point that people are making choices very dangerously to move to other territories. So for me, is to just reanalyze and say the root causes of this is to have more and more development partners to address the root causes of this. And I would hope the studies like today would come up, the study that we're discussing today would come up with really granular analysis on this. That's it from now. Unless there are any burning questions, I think we can allow Joseph to continue on with the next presentation.
Just to acknowledge that we have heard from some of you online that the video quality is a little pixelated. So we're working on fixing that to make it as good as it was this morning, but hopefully the sound is good. And we will be sharing the PowerPoints, at least from our side, but I think if with the speakers' agreements also more broadly, so that those of you who want to delve a little bit further into it can see the various presentations. So thanks very much, Kennedy, for your intervention. I'd like to now pass it over to Daniel from IOM to take the floor. And he does not have a PowerPoint, so we can take this.
Thank you. Right, so I'm Daniel, I'm coming from IOM on behalf of my colleague Zineb, who couldn't make it today. And I'm going to quickly present the findings of two studies that's actually underway. One is in conflict, which will be published by the end of the month. And the other one is in youth, which would be published in the first quarter of the next year. So what I'm going to present now are some preliminary findings that my colleagues are working on. Those findings would be referred to the Northern Route, and some of them are actually aligning to the ones that Kennedy already mentioned. And then secondly, I will talk about some of the key findings that we also got from a report that is already published, and which name is To Change My Life, and that's more focused on the Eastern Route. Right. So yeah, focusing on the Northern Route from the two studies that I mentioned. Well, it's well known that Sudan is a transit and destination country, and we have seen like a large inflow of migrants over the past decades. So mainly Ethiopians and Eritreans. In the first case for Ethiopians, since 2020, the number of refugees multiplied by 10 in Sudan because of the conflict in Tigray, and I think this aligns with the dashboard that was shown previously. And in the case of the Eritrean refugees, as Kennedy also mentioned, because of the forced conscription. Also, one of the key points that we found in this study is like second generation refugees in Sudan often do migrate in the northern route because of what we already mentioned on the economical situation of Sudan, political crisis, civil unrest, etc. Right? Also, one thing that we need to bear in mind is that the data collection for these two particular studies were conducted before the conflict. So we also need to be mindful of that. So the situation might have changed. Most of the refugees they feel unsafe, as we all know, and one of the reasons for this is like in some cases we observed that some refugees which have regular documents to stay in Sudan, sometimes they get arrested regardless regardless if they have or not documents to be in the country legally. And then when it comes to the Eritrean nationals, we can see like there is as Kennedy mentioned, like it's like an age and gender specific migration of children who are forcibly recruited by the government to join the army. So you might think that school might be like a safe place for children, but in some cases that would not be the case. And also we have some common profiling of the migrants for both Eritreans and Ethiopians and also Sudanese. The dominant narrative is that in their communities that you can make more money in Europe than you would ever do in Sudan. And another key aspect that we found was that freedom was really highlighted by people who was surveyed. Because, for example, around 1 in 2 did not feel safe or free to move and express themselves. And usually migration to Sudan did not provide the significant improvements that they were looking for. And I think in this case is in the context of Eritrean nationals, probably the first thing you want to do is just get out of your country to avoid the forced recruitment. But then once you are outside of your country, then you might think ahead on your what's your next step in your migration journey. And interestingly, we also find that most of those migrants and refugees who are heading to Europe are looking for better education, because as we said, most of or some of those children are recruited by the army when they are still in school. So they might not, they might feel that if they remain at school, they might be forcibly recruited. Another key point that we found was like that there is different protection risks, and I think this is well known and was also mentioned in the morning session, where girls are more likely to suffer physical abuse, so 40% in this case, while boys 30%, and economically exploited was 18% for girls and 11% for boys. And more interestingly, for almost half of the girls were afraid of being sexually abused. So we also need to be mindful of those different protection risks among the children. And to finish with the findings from these two studies on the northern route, those children migrating are usually more aware of the risks that is usually reported in other routes, like in the eastern route towards Yemen and Saudi Arabia, or the southern route. Right, so I see that I have 3 minutes left, so I'm going to jump in quickly on the. Oh, okay. Cool. So on the eastern routes, it's well known that it's mostly migration drivers are mostly economical, but often we see underlying migration drivers that are sometimes difficult to catch or to report. So, and in some of those ones are land related and climate factors like fragmentation, erosion of soil, overexploitation of underground water, lack of money to have fertilizers, etc. And it's also well known that migration through the eastern route comes mostly from rural areas, which are relying mostly in agriculture. The coping mechanism, of course, in most cases is migration, because either people do not have income, and in the report that was published, 75% of migrants departing from Ethiopia reported that they did not have any income, or either they had intermittent salaries or wages, so like around 50 USD a month. Then in some cases, those international migrants have previously migrated within Ethiopia from rural areas to urban areas. However, in most cases, this internal migration does not satisfy the goal of the migrants, right? So because either they find difficult opportunities of job, they don't have network of relatives or friends to find a job, and in case they get the chance to get a job opportunity, in some cases they might not be able to sustain themselves because the gain that they get is not enough to sustain themselves in the urban areas, which are usually more expensive than the rural ones. And here is also something really important, that are the expectations and also the influence from family or friends who succeeds on their migration journey along the eastern route. So they feel somehow amazed that they were not, that they cannot actually provide for the families. So they have like bad feelings because they cannot support their families when they see that their peers, their friends, or other family members have succeeded in the migration journey. And also interestingly, in both the eastern route and the northern route, we found that in some cases, or most of the cases, children do not tell the families that they are taking a migration journey because they are afraid that the family will tell them not to do so, right? And I think I have touched upon everything that I have here, but of course we can leave room for further discussion. Thank you.
And our last panelist, as I said at the top, is Joseph from MMC, who's going to walk you through some of our key findings from the EAMR project in relation to drivers and onward movement intentions.
Thank you. Just give me a minute. So I'll just take a minute to open it up. This is not my PC. All right, there we go. So for this particular session, I will real quickly present to you some of the findings that we have had from the data we have collected. Okay. So I'll not go into details about the sample overview. And here we go. So a lot has been spoken about the reasons to why migrants and refugees and other migrants are moving. And as we are looking at this, I would like us to also remind ourselves that 40% of our respondents were refugees and 60% were other migrants, different profiles, right? And what I'll be speaking to is the mixed migration trend that you're seeing along the route. And one of the things, and which is very clear from this, where we are seeing violence, insecurity, and conflict, followed by rights and freedoms, and economic reasons or drivers relating to those top three topics there or themes are coming out real clearly from our data. So when you think about why people are moving, mainly the reason why these people move are the social, economic, and political context of the places where they're coming from, and the perceived opportunity as well of people of this intended destination. So here, the top three, violence, insecurity, right and freedom, and economic, really reflect the conditions that are in the places of origin for migrants. And here, when I say this, I'm talking about respondents, our respondents profile. They came from Eritrea, Ethiopia, South Sudan, Kenya, and so on. And as it was mentioned at the beginning of this event today, it was mentioned that the region has really experienced a quite variety of events, including violence, and in Ethiopia. Right now in Sudan as well, we are experiencing a similar thing. In Kenya, here, as you can see, 100%, all of them, because they were interviewed in southern Ethiopia, and most of them came from northern Kenya, where violence and conflict was the same.
So it's really quite very profound and very evident that mixed motivation for moving is causing respondents to move from their places of origin across Ethiopia and Sudan into their intended destination. I will speak a little bit more about what you're seeing here on the screen. So on the far end there, you're seeing the reasons why respondents interviewed in Ethiopia are moving. And you also, on this other side, you're seeing in contrast, reasons why respondents interviewed in Sudan are moving. So on that side, you will see that the color red is not that much, and respondents are actually mentioning very few drivers, right? They're mentioning violence and insecurity most of the time, that is South Sudan and Kenya. And on this side, you can see the red color is quite diverse here. So here, basically, you can say, or you can infer that different nationalities and people from different regions are able to identify in Sudan, they are able to identify multiple factors for them to move, whereas in Ethiopia, they were mainly mentioning the drivers that had most of the impact, most of the impact for their reason to move. So maybe to zoom in a little bit on this, because, for example, and this was mentioned in another forum, in Ethiopia, you're saying majority of the respondents talking about violence, insecurity, and conflict, and rights and freedom as well. Remember, we said that majority of them were coming from the northern of Ethiopia, right? And therefore, they are taking the northern route. But in our data set, different data sets that we have collected along the eastern route, we have seen that most of them, or people coming from Ethiopia towards South Sudan, towards Saudi Arabia and other Gulf countries, are mainly saying that they're motivated to move because of economic reasons, mostly. I will go back and maybe mention something here. So economic reasons for moving here are not that prominent, and 37% are saying this. Like I've said, this is not what we have seen in other data sets that we have collected in this region. And this here, sorry, I'm having a problem, challenge with my machine. So the cursor disappeared on me, but I'm back now. So in other MMC datasets, we often see economic factors feature more highly, as well as reporting of multiple drivers. But here we are seeing that it's not that so much, and violence, insecurity, and conflict is being mentioned by most of the respondents. So this here, we believe, reflects more acute the more acute experiences with conflict, persecution, and the prevalence, as well as you have seen, of Eritrean and Southern respondents in the sample here. And you can see that in both Ethiopia and in Sudan, we have quite a significant number of Eritreans, and in Ethiopia, we have a significant number of South Sudanese respondents here. Overall, these drivers that have been mentioned here were similar across sex, age groups, and amongst youth and caregivers. Now I will zoom into these reasons relating to violence, insecurity, and conflict. So as we have established, violence and insecurity in the areas of origin is mainly quite high. And here, therefore, it's no surprise that the reason related to violence, insecurity, and conflict in this case was armed conflict. But we also had people quoting political unrest, crime and general insecurity, and then a smaller proportion quoting sexual and gender violence, domestic violence. So again, for those respondents that mentioned violence and security, which was very high, then across youth, caregivers, and age groups, we see the same or similar number quoting these as the reasons why they moved. Looking to the second highest reasons for moving, rights and freedom. A majority of the respondents said that the reasons relating to rights and freedom was lack of freedom of expression, movement, association, or repressive governments, discrimination on a political affiliation, and so on. Here, overall, I would like to zoom in on a nationality that people have talked about, Eritreans. So overall, the majority of Eritreans, that is 57%, cited that they were moving due to this reason, to reasons relating to rights and freedom. Out of these, out of the Eritrean respondents that mentioned these, 72 and 71% cited lack of freedom and forced conscription. And this was the same across caregivers and youth. So these experiences of forced conscription or running away from forced conscription and lack of freedom was experienced by both youth and caregivers. However, it was more felt by Eritrean men, where 68% of Eritrean men cited this compared to 48% of women who had identified right and freedom as a reason for moving. Talking to the reasons relating to economic reason, again here, although it was not highly mentioned, when you look at another data set, and this is how the disaggregation by gender for respondents who are able to identify economic reason as a reason for them to move, we see that lack of employment, not earning enough money, and difficulty in doing business were the reasons relating to economic reason. And overall, however, we had a question asking whether our respondents were making money before, 12 months before they decided to move. And overall, 63% of our respondents said they were not making money. So lack of employment or lack of source of income was considerably high. And it was higher for women, with 70% of the women we had interviewed saying they were not making money before deciding to move, and 55% compared to 55% of men. Zooming into youth, this proportion was even higher, with 72% of the youth we had interviewed saying they were not making money. And out of these youth, 83% of young women were not making money, and 64% of young men are not making money. Therefore, highlighting that economic opportunities was less for the younger people. So those are the reasons for moving. And what are then therefore the movement intentions? Because we also say that aspirations for a better future also influence the reasons or aspirations to move. So majority of our respondents at the time of the interview say that they intended to move and continue their journey, with majority of them saying that they wanted to move to Canada, Europe, United States, and so on. Here, we would like to highlight that The preferred destination for different nationalities differed. Eritreans and Ethiopians were in favor of Canada, at 59% of Eritreans saying they wanted to move to Canada, and that 6% of Ethiopians saying they wanted to move to Canada, while a majority of South Sudanese, that is 48%, said that they preferred moving to the United States. Now, looking at this, we see that our respondents have aspirations to take quite considerable long journeys. If you can think about where Ethiopia is, Sudan is, and the intended destination, right? Then realizing that the pathways to actualize this is becoming quite limited, and it's becoming continuously difficult to achieve this. And therefore, we believe and we reflect that these migrants are looking at where they want to go and seeing that they're saying that they still want to continue moving with their journey, they are more likely to continue undertaking these irregular journeys, which are quite precarious. Even on short-term journeys, like if you look at the 2%, which is not that much, moving to Egypt, and also thinking about what is happening across Sudan and the difficulties experienced due to the conflict in Sudan to move to Egypt, then you can appreciate that it's not going to be an easy journey, and they're still going to continue experiencing a lot of difficulties. So what are the aspirations of the youth that are en route to move to these destinations? So that most of the youth that we had interviewed said they, in considering the destination, they had considered that the destination had economic opportunities. 62% say this, generally better living standards as well. And 48% say that they considered safety when choosing these destinations. On the other side, for caregivers, you can see that a majority, that is 59%, say that they considered better living conditions, 53% safety, and availability of economic opportunities at 50% when choosing these conditions. In Ethiopia, economic opportunities were cited by 63%, followed by better living standards in Sudan for the caregivers. And in Sudan, considerations were much more profound or diverse, with 72% saying they considered better living conditions, safety 71%, as well as human rights was also considered by respondents by caregivers in South Sudan as a reason for moving. Yep. Okay, thank you. So what are the implications for this? So here we see that multiple drivers of movement are causing people to move from one location to the other. And these factors are overarching and are driving their migration. Within that factor could be profound multiple reasons and triggers. Then rather than move as part of their aspiration, many expressed being forced to move, supporting people's choice to stay, therefore means programming. We need to create programs that address systematic, political, economic, and societal issues. Then, given that, like I've said, given that the intended destinations of these respondents seems to be very long, then therefore it's more likely that these migrants are more likely to take irregular journeys, and therefore an increase in programming that promotes safe pathway needs to be put in place. And an example is the safe mobility offices that the United States is piloting in Latin America could be something that might be viable for our region and to promote safety of our migrants along the journey. And then the shrinking space for refuge within East Africa are very limited and most of the time underfunded. Therefore, we need to provide safe and viable places for sanctuary for people on the move, especially if we don't want them to undertake unsafe journeys. Thank you.
I invite all the Okay, so what we're going to do is have our Q&A because our time is running out, and then we're going to restart the internet so that those online, I think that might help the connection a little bit. Okay, great. Is there any way I can swap this mic for another one?
Gender insensitive.
Okay, great. So a lot of data were presented around drivers. And of course, this was put into a larger regional perspective by both our panelists. So can we open up first to see if there are any reflections or questions from the room? Yes, Gregor. Let's get you a mic. There we go.
Yeah, thanks a lot for the presentations. And I kind of saved a question for this panel from the previous one. I'm having UNHCR, IOM, and MMC there. So I'm going to ask two questions. So the first one is, and I think it came through in the presentation a little bit, that given that there's, let's say in Sudan, this very complex group that includes IDPs, it includes cross-border refugees, only some of whom request protection status, like in Egypt, for example. I think it's only a third that kind of try to reach out to UNHCR for extra status. Then we have internally displaced migrants, internally displaced refugees. Like, how do we, in our kind of individual mandates, kind of our groups that we focus on, kind of get a more comprehensive picture in terms of data, if that question makes sense? And that's partly from personal experience, trying to kind of get that comprehensive picture, that you kind of look at UNHCR situational reports and you find some of the numbers in more detail than others. With IOM, you find a different set in more detail. So how do you, for example, particular gap of displaced migrants in Sudan, which kind of seem to slip through the net a little bit? So that's the first question. The second question, I think also to all speakers actually, how do we reconcile the kind of complexity of decision making, and that is the drivers on the one side and the aspirations on the other, and kind of so and I think the Eritrean youth are kind of a really interesting group to me, because I think we kind of struggle to capture what seems like a very simple phrase, and I think there's some good qualitative work out there on that group as well. The phrase being, I want to leave because forced conscription is stopping me from pursuing what I want to do. Like, where does that statement fit, and how do we actually kind of reconcile it with not just dumping it as a clear driver, But and yeah, so how do we kind of merge these? And I thought it was interesting to see that there's a bit of a discrepancy between the aspiration statements and percentages and the driver statements in the kind of data set from our work. And yeah, so it's just like, how do we then deep dive into kind of understanding, because to me that's kind of key in like the work in ensuring safe migration, right? And kind of understanding what is motivating, what kind of awareness raising do we need to do? Like, risk awareness might already be there, really, but if we just look at drivers, we might miss the kind of other half of the picture. So that was 2 very long questions.
Is there a third in the room that we can round off the questions with? Or should our speakers dive in? Okay, then I think let's go with, how about Daniel? Do you want to kick off on getting a comprehensive picture of the data? And then we'll go to Kennedy.
I think that's quite difficult, to be honest. And from a technical or analysis perspective, I think here semantics is really important, right? Because if we need to define the mandates of each of the UN agencies, my understanding is that UNHCR mandates is refugees, and correct me if I'm wrong, and then IOM is IDPs and migrants. The thing is that when we go on the grounds, sometimes it's difficult to see, okay, are you a migrant, are you a refugee, are you a asylum seeker, are you an IDP, are you cross-border displacement? So I think the semantics here is really important when it comes to the data aspects and also on the field. And this comes from, at least from an IOM perspective. From the DTM side, one of the limitations we have is that in the flow monitoring, or when we do mobility tracking to know the figures of IDPs, in most cases, those are self-reporting. So also, does the person that we are surveying knows the differences between what an IDP is, what a refugee is, what an international migrant is? So that's one of the limitations that we have in our methodology, and I think we should, move forwards on this. And then on the second thing, on complexity of decision making, this is, we struggle quite a lot over the past drought that we had to identify migrants because of climate change or because slow onset, meaning drought. Because people often have, they are either farmers or pastoralists, right? So they will tell you, no, I'm migrating because I'm going to Djibouti to find a job because I lost my job. And then when you dig a bit on it, and this is again, because this is self-reporting, I lost my job, and then when you dig in a bit, they will tell you, no, because my cattle died, or because, I could not farm on my land. So then when you dig in a bit, then you see all those other underlying conditions. So yeah, I think those would be my to discuss further.
Kennedy, would you like?
Yeah, I agree with my colleague. Indeed, it's as you presented, Gregory, it's very complex. I think from the Sudan crisis, we learned quite a lot. As Asma indicated, it was quite enormous in terms of movement. I think this is the biggest movement globally, second to maybe Syria, or at the moment what you're seeing in Palestine to some extent. However, just being a little bit practical and seizing the opportunity for cooperation, and as Ayla indicated, and that's why we are here. We are here to share the data, and I see the opportunity to cooperate and use the data that has been for today's research used for our own programming. So I see that opportunity for greater cooperation amongst all actors who are working both in mixed movement, migration, as well as refugees. I see that opportunity, and if we can try to be a bit practical in terms of some aspects which are more of governance regarding the data sharing protocols, and seeing how we can go beyond that, I think the end result would be really to use these surveys that you've been really doing a lot to analyze, and I would hope in the near future they would have a consolidation of such data sets, like I heard from Elena, their study, what they are going to publish very soon. We also did a study in the 4 countries to see how we can really consolidate this for the use of our programming. That would be the desire. And we began that kind of cooperation. We have MOUs with other UN agencies, one of which is IOM. We have a framework of engagement which is being reviewed to look at one of the pillars is actually data. And the other 5 pillars are more of how we work together in responding to mixed movement situations, because we can't really have that one hat, especially in the Sudan crisis. We learned that we needed to be a bit flexible, and you've seen traditional roles that are being played in Sudan at the moment. On the second one, I think closer to what Mimi indicated, especially for the traditional movements, I think by now we should be analyzing, like I mentioned, traditionally in east part of Sudan, it's been known that that is a route. In Kenya, this is the country of city of exit. I believe there could be opportunities for us to really see that these trends are continuing, and what can we do? And an example is, as Joseph presented, one of the reasons why youth sometimes want to leave a country is education. If we can provide these kinds of support, if to deter, it would really be beneficial. If it's beyond that, for example, like Mimi indicated, legal pathways to maybe labor mobility, which I think is being used more and more in Europe. And we have these schemes where we have countries who would want to support in these labor mobility schemes to try to address the issue of youth and children making those very dangerous journeys, whereas there are those pathways that they could have used legally. I think that's how far I can be able to respond to this. Thank you.
Do you want to chip in?
Maybe I can comment and maybe reflect on the second question that you asked on how we reconcile drivers and aspiration. So here, what we can say is that when you're talking about mixed migration, it's most likely that people talk about drivers, and especially drivers independently, right? But when you're talking about mixed migration, other than looking at the mixed movement of people where refugees and other migrants are moving along a same road, we should also be looking at the mixed motivation for these migrants to move, where drivers are interconnected, where like economic drivers can be interconnected due to violence and conflict, environmental factors, and so on. And also shifting motivations along the route as these youths are moving along the route. The aspirations also keep on changing. And then at the core of it all is the desire to get a better life. So when you're talking about drivers, when you're talking about aspirations, I think what connects all of them is these people's desire to get a better life. And therefore, they should not be seen independently, but all of them should be seen as interconnected.
Questions? Yes, one here. Arauia. And then another, same table. Great.
So my question is for Kennedy. So you mentioned because of the conflict within our region, the eastern route changes quite drastically. So my question is, how does programming target the changing in risks within the region, especially now after the conflict in Sudan?
And can we go directly to the next question?
Hello, Lillian with the International Detention Coalition. And my question is for Kennedy, but also even the other panelists can answer. In terms of the context of mixed migration and the youth and the drivers that would make them move, are there any legal provisions, for instance, that would make a person leave, and especially when they're looking at the route that they will use and the context, how the migratory route keeps changing, legal provisions that would make them choose a particular country because, for instance, they're considering if especially they use irregular channels to enter the country, the aspect of immigration detention.
Great. Yes, Elena.
Thank you. My question is for the three panelists. I had the feeling that in this session came out a bit less the aspect of gender, or at least data speaks that there are no much differences between the drivers and aspiration in relation to gender. While we can assume that also based on the contextual knowledge we have, there are gender norms in each country that may play a role in the aspiration and maybe also in choosing migration, the capacity to choose migration as a way, a coping mechanism or not. And if there is any specific reflection you have based on your data research that came out a bit more strongly in the difference between boys and girls or men and women on this. Thank you.
Thanks for your question. Kennedy, do you want to kick us off?
Yeah. Yeah, on the first question on the really changing dynamics in the route, as you noted, we may not, how do I put it? You cannot predict when the next conflict will be. However, because this is related to the quite, I think Ethiopia and Sudan has been predominant in the past year or so. However, I think the aim should be to have as many partners as possible to be able to really dig into the reasons and also have preventive and reactive actions. And in our case, working with partners to have protection sensitive systems, as well as referral pathways, for example, working closely with UNICEF on unaccompanied and separated children, having best interest determination procedures together so that we are able to, in any situation as has been presented recently, we're able to really respond to it. It's like a sort of a contingency to respond, because what happened between the two crises, it was really, especially for Sudan, there was quite, we didn't really have that coordinated action. However, now I think with the MRP, we are looking at more predictability and coordinated actions among the actors. On the second question on the legal provisions, it is a preserve of the governments, which the individuals cross into their territory. However, there are those legal pathways. And as I mentioned before, alternatives, we call it, as Mimi had mentioned earlier, to these routes. And what we try to focus on, especially for refugees, we have schemes like resettlement, we have family reunification processes, and for the other agencies, I think IOM, the mobility pathways and the rest, to tap into this, and also scholarships for those youth and adolescents who would want to pursue education abroad. But this could be available in the region or the countries that they are living from to the extent possible. Gender?
Well, we had quite a split between our first panel and our second panel in terms of gender difference.
All right. Maybe to speak on the availability of legal provisions, and I'll talk about the way the different governments in this region and these countries where people are moving differently react to migration, and it tends to be quite prohibitive, I might say, where we see, for example, Eritrean respondents trying to leave, saying that they face challenges, right? Moving from that country into Sudan and so on. And therefore, this it's evident in our data that there is increased risk because of the actions that the governments are taking, maybe to restrict or make sure that these people are not able to move. On the second question on gender, it was quite interesting that most of the respondents that we interviewed, even though we had almost 50-50 split on gender, the reflections on the drivers and reasons for moving was almost the same. They were similar. But if you look at it a bit deeply, you can see small differences. For example, lack of employment. Here you see that, as I presented, more women said that they were not making money before they started the journey, and therefore it will point to economic difficulties as an influence for them to move, even though a similar proportion of women compared to men mentioned this. If you look back and see the economic opportunities available to women was much more than with men.
Yeah, on gender, I think two things from my end. I think one is more sort of operational, and when it comes to enumerators, I feel looking at flow monitoring data that when the numerator is a female, females tend to be more open, and they tend to report, they tend to be more comfortable about speaking out about the migration journey, right? Whereas if the numerator is a male, then the female might be a bit more, she might feel a bit more uncomfortable talking about it. So, and that's something that in DTM we try to always balance, right? And we even tell our enumerators, okay, if you are male, you better interview or survey males. If you are female, you try to target females, because this way, then you will be able to have like a better picture. And also, I didn't mention it during my presentation, but last year I went to Djibouti to conduct a focus group discussion. And as my colleague was also mentioning, the fact that women were not getting any income before the migration journey doesn't mean that, they were not actually working, right? Because most of them, we know that they work in the household, right? Looking after the children, looking after the households, etc. However, last year in Djibouti, I went to do a focus group discussion with a few colleagues. And in one of the groups, we were told, we did a focus group discussion with a group of Ethiopian women, ethnically Somalis. And they mentioned that the husband stayed behind because they felt like going to Djibouti and ask for money, they would be more likely to get support from the local communities. First, because they are female, and second, because they were ethnically Somalis. And Djibouti is largely Somali from an ethnic point of view. So this is a really particular case from that particular moment. And we don't really see this on our flow monitoring where we see, tens of thousands of migrants. But, this was something really concrete that we saw. And on the legal pathways, of course, they are much better than irregular migration, but we also need to be mindful that the fact that they follow legal migration pathways doesn't mean that they are not under protection risks. And here I have 3 examples really quickly. So for example, we see lots of Ethiopians going towards southern routes towards South Africa who do not require visa to transit towards Ethiopia, to transit towards Kenya, right? But then issues begin when they go from Tanzania, Malawi, Mozambique, all the way south. Then also on Ethiopia, I think it was February or March this year, I think they were open like almost 500,000 of domestic works in Saudi Arabia. And it doesn't mean that they follow a legal pathway. It doesn't mean that they are not going to be, abused or that they are not under risks. Same as Kenyan nationals going to Gulf countries. They follow regular pathways, but it doesn't mean that they are not under, protection risks. So, of course, much better legal pathways or regular pathways than irregular ones, but we also need to be mindful of that.
Thank you. We're running very short on time, so I would suggest that the rest of the questions we can save for the coffee break. Just a reflection from my side. I think kind of an overarching question to this panel has been, why is it so important to understand drivers and movement intentions? And also, how does status feature into this, and how do we capture complexity? And I think what's come through really strongly is that intended destinations can be, they can be extremely aspirational. And so when those aspirations don't get fulfilled, it's important that we know that they exist, because it could then have implications for people getting stuck along the way and find themselves in precarious situations, especially if they don't find services and opportunities along the route. And understanding drivers is another insight into people's experiences and needs. And we know that many don't apply for protection, either because they might not necessarily qualify, even though they have similar experiences, or because not everybody wants to be identified as a refugee, or the country that they find themselves in doesn't recognize the 1951 Refugee Convention, and the status changes over the course of the route. And so interrogating these things is a really integral part to understanding needs along the route, and is not an academic exercise where we're trying to conceptualize one factor over another. So pushing also back on the need to rank drivers and reasons is also really important, I think, in all of our work, and just to be okay with recognizing the complexity. So I want to thank our 3 speakers for helping us do that this afternoon, and for really whetting people's appetites to maybe delve a little bit more into this data during the coffee break. So thanks. I'm not as eloquent in Rhoda in our clapping, but let's give everyone a hand. Thank you. And for those online, we'll come back at 3:20. Thank you for the final panel. I think it's just maybe we can spend on.
No, it's very sad.
Wena uhlezi usengqondweni yami, uhlala usenhlizweni, mawubuya khumbula, uhlezi usengqondweni yami, uhlala usengqondweni yami. Mawubuya, mawubuya, khumbula, khumbula, mawubuya, mawubuya, khumbula.
Hello? Can you hear me?
Come on, come on, come on, come on, come on, come on. I think that's fine.
Hey, Sarah, can you hear us? Hi, Sarah.
Hello?
Hello, I can hear you,
Hello,
Sarah.
everyone.
Can you hear me?
Welcome back. to our third and final panel of the day. And that will be about unique experiences of caregivers and of unaccompanied and separated children on the move. To really shine light on these particular context, to dive a bit deeper into the data we have collected as MMC, as well as the qualitative study carried out by Niklas Meyer, who we already mentioned earlier, the qualitative study on children and youth in Metema. Given that we're starting 10 minutes late, without further ado, I would like to introduce our colleague, Sarah Ali, MMC project coordinator for Sudan, to join us and present the MMC for my data on for this panel. Over to you, Sarah.
Thank you so much for the introduction, Jim. Hi, everyone. I'm happy to join this session online. My name is Sarah Ali. I am the project coordinator. Sorry, my camera is off. I am the project coordinator for Sudan and South Sudan. So this session will be relatively shorter. So in this session, we will delve into the experiences of children and caregivers on the move, exploring the concept of care and the diverse care arrangements employed. We will also illuminate the perspectives of caregivers on their children's experiences, and highlighting the specific needs and challenges and risks that they encounter. Additionally, the session will examine the implications of traveling with children on decision-making. We will also present the implications and recommendations for programming towards the end of the session. Next slide, please. So I would like to begin by showcasing the caregiver sample profiles of the participants. You see that in Sudan, we have 405 caregivers, and in Ethiopia, 405 caregivers. And in Sudan, we have 370 caregivers. The average number of children is the same across both countries, which shows significant challenges associated with caring for children while traveling, or a big number of children while traveling under adverse circumstances. I see that the presentation is not very clear. Can you please make it bigger from the panelist? I don't have control for the presentation.
We can see it pretty well, Sarah.
Can see it? Okay.
Yeah, we can see it.
Okay. So I was saying that the average number of children is big across both countries, so caring for 4 children while traveling under very difficult and adverse circumstances. So among these respondents, we have a segment of caregivers who are youth themselves, so ages between 18 and 24, which brings about protection concerns for youth caregivers. You see that 26% of respondents traveling with 4 children plus in their care in Ethiopia, and in Sudan, the number is 23%. So in terms of breakdown by nationality, the majority of respondents in Ethiopia were Eritreans and South Sudanese, with also Kenyans and Sudanese and Somalis, while for Sudan, the majority is Eritreans and Ethiopians, with some South Sudanese, Nigerians, Chadians, and people from Central African Republic. Overall, we have less diversity in respondents in Ethiopia, and slightly lower education levels. So 41% of men and 21% of women had completed secondary education. 55% are refugees, and fewer migrants and other undocumented status. Conversely, we have more diversity of respondents in Sudan than Ethiopia, but it's important to note that we're still collecting data in Sudan. The data shows higher education levels in Sudan. So nearly 50% of men and 40% of women had completed secondary education, and 47% of them were undocumented migrants with no legal documents to stay in the country. Next slide, please. So in this slide, we will get to know the different care arrangements. We have asked the respondents about we have asked the caregivers about their relationships with the children. And overall, when we say caregivers, we mean the person who is responsible for providing direct care for the children. You see that overall the care arrangements are different across Sudan and Ethiopia. In Sudan, you will notice that the care arrangements are more diverse. 40% of the children are traveling with caregivers who are not their biological parents. It's slightly different in Ethiopia. 94% of children are traveling with parents. You will also notice on the left the high prevalence of sole caregivers, with 64% in Ethiopia and 82% in Sudan are sole caregivers. This also highlights the need for comprehensive support systems to address the multiple vulnerabilities these segments face. 18% were sole givers and traveling with 4 or more children in their care. Next slide. So in this slide, we asked the respondents if the children in their care are experiences any healthcare related difficulties. 20% of caregivers respondents are traveling with children who are facing challenges, health challenges. The challenges vary from mobility challenges to other challenges related to understanding and communication. This also relates to the unique circumstances and vulnerabilities that I mentioned earlier. Next slide. So we also asked the respondents, would they have made different travel choices if they weren't traveling with children? This is a multiple choice question. You will see that the preparations for the journeys and challenges when traveling with children is different. So most caregivers would have made a different travel choice about their journey. Had they not been traveling with children, the choices are related to choosing different routes or different travel modes, or choosing a completely different travel destination. The data does not vary very significantly pre and post conflict in Sudan. Next slide. So in regards to the services that the children need, we have a comparison between the services needed pre and post conflict in Sudan. So you will see that pre-conflict, the top 3 cited services were education, healthcare, and psychological support. And post-conflict, you will see that the needs have changed to healthcare, education, and shelter. You will notice the big shifts pre and post-conflict reflect similar priorities in displaced populations in Sudan, showing a collective impact on all groups in Sudan. You will also notice a rise in basic services since April 15th, while services like education and psychosocial support are less reported, likely owing to the reshaping of the priorities. It's also crucial to note that just because the respondents are not expressing the needs for education and psychosocial support as much as the need for food, water, and healthcare, does not mean that they are less in need of these services, and they should be deprioritized, which is also reflective of conflict-affected communities elsewhere. Next slide, please. So here we have asked the respondents about how long they have been traveling with these children in both Ethiopia and Sudan. The care durations in Ethiopia are different from Sudan. as you can see in the graphs. So in Ethiopia, 87% of the children started the journey with their caregivers. 18% were born in the country of the interview, while in Sudan, you see that 78% started the journey with their caregivers and 14% joined caregivers in the country of interview in Sudan. This means that 14% of the children in Sudan joined their caregivers at a later stage in the journey, which could also be reflective of unaccompanied or separated children or caregivers making the journey alone first and then children joining them later. It also highlights the different care arrangements for caregivers and children on the move. Next slide, please. So in this following section, we will touch base on the different risks caregivers cited for their children in Ethiopia and in Sudan. So starting with Ethiopia, for both boys and girls, nearly 40% of caregivers cited that there were no risks on their children, which is a bit surprising. But for the boys, the other two top risks were discrimination and physical violence, while for the girls, it's harassment and discrimination. Next slide. So you will see here that in Sudan, the caregivers cited higher risks and in addition to multiple risks. So it's very different from the data we just showed for Ethiopia. The top three risks cited for boys are insults, physical violence, and detention, while a bit similar to what was cited for the girls. The top two are the same for the boys and girls. So harassment, and also harassment being the top, the third top risks for the girls. You will also notice that the discrimination is higher for boys and girls, amongst boys, but for girls they cited higher risks in sexual violence, and it was also cited more often. 41% of the respondents cited that the girls are at risk of sexual violence. And it's also important to remember that sexual violence, this type of violence can be underreported. Next slide. So finally, we have the implications and recommendations. So firstly, we can start by the need for targeted assistance for caregivers, which focus on their unique vulnerabilities. Also increase recognition for diverse families on the move, given that the care arrangement can evolve or start along the route, and family ties may not be biological. And also noting that the importance of disability-friendly assistance, and also the need for awareness raising, targeted awareness raising on the risks of migrating with children. And finally, the increased protection assistance for children and caregivers in transit hubs, borders and crossing, and also the increased support for protection programming in Sudan to correspond with the considered rise in abuses and needs since the outbreak of the conflict. So this is the end of my session. Thank you so much for listening.
Thanks very much, Sarah, for this deep dive on the complex situations of caregivers on the move in Ethiopia and Sudan. And thank you for the applause, well deserved. Let's move on now to our second speaker, Niklas Meyer, who will present the qualitative study conducted in Metema. Over to you.
Thank you so much. I think the technical team is working on putting the PowerPoint presentation. It's on that laptop. Okay, please. Oh, there we go. Last one. Perfect. So I can change the slides here, yeah? Thank you so much. Great. Thank you for everybody who's still here in the room and online with us. It has been a long day already, and I think before the keynote speak and the wrapping up, it's the last presentation. We have heard a lot of rather quantitative data and studies until now. So this one now is qualitative, and I think it sheds light on the different aspirations, intentions, protection needs, services of children on the move, specifically in transit. And this study has been conducted in Metema, which is, yes, just to briefly show it on the map, it's at the border between northern Ethiopia and Sudan, one of the main transit points on the northern migration route. So it was called MMC, Qualitative Research on Ethiopian Migrant Children and Youth in Metema. We're speaking to both onward migrants and returnees. So we conducted the data in July and August this year. So Metema was undergoing and is still undergoing a lot of rapidly evolving changes linked to the conflict situation in Sudan. Just the first month after the conflict started in Sudan, that means between mid-April and mid-May, over 27,000 people crossed from Sudan into Ethiopia via Metema. That includes refugees from Sudan and Eritrea, and also returnees from Ethiopia. So, and at the same time, still a lot of onward migrants, mainly from Ethiopia itself, onward youth and child migrants are coming to Metema. So it's a main transit point. And we conducted 20 in-depth interviews, 4 focus group discussions, 5 key informal interviews with both onward migrants, returnees, all of them Ethiopian nationals, and half of them male, half of them female, boys, girls. And the 2 age groups are children between 13 and 17 years old, and youth between 18 and 23. As a disclaimer, this is the preliminary findings, and the full study will be published soon. So speaking with those respondents, there were several patterns, namely that many of them, both returnees and onward child and youth migrants, came mainly from rather rural areas, which are at the same time drought affected, where there are less employment options, and where the population density is rather higher and household members rather numerous. So the reasons that different respondents gave us was poverty, hunger, inability to attend school, as well as, especially for girls and young women, family responsibilities, especially if they are one of the older children in the household. There was this common sense of responsibility that if there's not enough money in the household for the younger brothers to go to school, that the older sisters had to migrate and send money back home. That was also one of the perceived drivers, family responsibility, especially for female respondents. There was peer pressure, social networks, and culture of migration. Many of the respondents that we found came from similar areas. So it seemed like people are getting influenced by hearing that neighbors, friends are doing this similar migration journey. People perceive that they're more capable of doing it if they already know people in the transit places or in the intended destination areas. So all of this also reinforces or increases a bit the aspiration and also the perceived capability of being able to do this kind of migration journey. Linked with the first point, unemployment and lack of having a satisfying and fulfilling future in the area of origin. Culture of revenge was mentioned by several, that in northern Ethiopia, you have this culture of revenge. If some of your family members broke a cultural rule, then there could be revenge taken on your whole family, and many were also fleeing because of that. That came up a couple of times. Some quotes to make it more lively. One or several, of course, mentioned that, but here just to illustrate. When I'm in school, I will need things like practice books and a pen. If no one assists you, you will be forced to migrate. It is this issue that is forcing me to move. So there's kind of the implication there that it's not completely voluntary, but rather the person felt forced to go because of the inability to attend school, which is again linked with poverty, that the parents cannot provide school material or clothes. That is forcing children and youth to drop out of school and to migrate. Then related to what I mentioned of family responsibility, a youth female returnee said, related to why she first left Ethiopia: after my mother died, I had to leave my home and go to Addis Ababa to work as a housemaid. If not, we were about to die of hunger with my sister. I was only 13 when I left home. After some time, I went to Sudan in order to help my sisters. So there, it's rather coming up in the female focus group discussions and the female in-depth interviews, that this sense of first thinking about the siblings rather than about the own goals for the future. This kind of sense of responsibility to provide for the younger siblings. Then we could also see that many, both returnees and also onward migrants, youth and child Ethiopian nationals we are speaking about, get stranded in Metema. We could see that at the moment of data collection, the returnees stayed rather a little bit shorter period of time, but the onward migrants on average had already stayed around 6 months. So the reasons related to that is the conflict in Sudan. We were conducting the data collection in July and August. So since April, many of the respondents we spoke to were already there since April, or even a little bit longer. And they felt like they couldn't go on because it's not safe enough. They said, we see that so many of our brothers and sisters, they mean Ethiopian nationals, are coming back to Ethiopia. So how can we go now if they are just returning because they say that it's not safe? So they also got warned by brokers or by other contacts, and that's why they waited. And most of them wanted to work and wait in Metema until they can continue their migration journey. At the same time, the population in Metema increased a lot because of the returnees, because of the refugees, and there were emerging economic opportunities. In Sudan, there's a shortage of basic goods. Most of the respondents mentioned soap, water, juices, biscuits, cookies that were in high demand, and by bringing them over the border secretly, they could earn a living as a daily laborer. So many also appreciated this emerging economic opportunities in Metema to stay a bit, earn some money, and then go on. So it's this kind of notion of a transit place where you can stop a little bit, reconsider your plan, earn some money, make networks, and then decide what your next step is. Yeah. So it's also an example how a migration journey is not linear, and often it's not how you planned it when you left your town of origin, but rather there are several steps, and you continuously balance your opportunities, and you continuously get more information, get to know more people who can help you on the journey. And that's the kind of step-by-step process that you can also see here in Methema. Some wanted to go on, but they didn't have the money yet to pay brokers, because mainly on the way towards Europe or towards Northern Africa, Middle East, and Europe, the next step or the next trajectory from Methema was Khartoum. So many saw Khartoum as the next step where they could go, again, wait a little bit, and then go on towards Europe. So for this trajectory, they needed some financial resources, which they didn't have. So many had the plan of waiting in Methema, working, and then when the conflict calms down, or when they're able to pay for the brokers to go on then. Then there was also the inability to return home empty-handed, because many of the family members and neighbors, friends had this expectation that if they would come back from the migration journey, they have to be successful and they have to be fulfilled and they have to bring money, and you have to see the change. If not, they would feel stigmatized, and they would feel faced with negative reactions also from the family. So they felt like they have to wait in Methema, earn money, or still try to go on to Sudan, rather than going home because they didn't fulfill their migration goal yet. And then a lot of women also married in those transit points, which then again adds another layer of complexity to their decision making of either going back, moving on, if they get married and maybe even have children. We didn't see that so much in the male respondents, that they get married along the way, but rather in the females. A quote related to this step-by-step process of migration. One person saying, this is related to the emerging economic opportunities in Methema. I've changed my job and am now working as a daily laborer. There are plenty of job opportunities by smuggling different goods over the border to Sudan. Together with my friends, we sent 11 big boxes of biscuits, and we got around 50,000 birr. We invested that money again to bring soap to Sudan. This work is fine for me. My life in Methema is good. I'm eating 3 times a day, and I'm wearing nice clothes. I'm sleeping in a nice house. So for that migrant, it's going well with this emerging job opportunity. And he mentioned to still aiming to stay a little bit more and to save money. As to services, we ask specifically about services that both Ethiopian youth and child onward migrants and returnees could access in Methema. And none of the interviewed onward migrants received services. They also said, we haven't heard about anyone who received services. And they also didn't have any information or didn't know who to approach. So basically, they were just living like any other local, working, paying their own accommodation, paying their own food. And the returnees, they had a bit more support. They had 1 meal per day, limited shelter, sleeping opportunities, in theory, free access to healthcare. But because of a shortage of places in different shelters and different sleeping arrangements, and also due to shortage of medicine and drugs, in practice, that was not really the case. And many mentioned to sleep outside on the street. It was rainy season, and there was a lot of mosquitoes and malaria. So there were a lot of reported health issues related to getting sick and not having access to medicaments. Many, like I said, aimed to stay and work in Methema, and felt constrained to go back to their own area of origin because of this expectation from their family, and because their migration aspirations or their goals were not achieved yet. And especially the returnees, they often left their old lives in Khartoum, for example, in a hurry, leaving behind belongings, property, and they plan to go back as soon as they could. And also most of the onward migrants were also planning to go on as soon as they saved some money and as soon as also the conflict situation calmed down a bit. I will skip that. That's a quote of a child returnee who was living in Khartoum. She said, "I was in grade 7. The last time I went to school was the Saturday before Easter, and we were told that we had exam the following week. Then before we left the school, shooting started." So that was also how it was all of the sudden that things changed, and then they were leaving in a hurry, leaving behind sometimes family members or belongings by coming back to Ethiopia. To finish up on some recommendations, the Ethiopian returnees mentioned that they felt discriminated compared to Eritrean refugees and Sudanese refugees, who they felt got by far more support than the Ethiopian returnees. So they said, we came together and we are here together, and this is even our own country, but the Sudanese and the Eritrean get more support. And that was mentioned by 5 or 6 different returnees. And that's why the recommendation is that services should also reach Ethiopian returnees and onward migrants. The onward migrants, none of them knew who they could contact in case of difficulties or what kind of services they could possibly get. Then the second point related to the shortage of shelter, accommodation, and medicine, that should be improved at the same time. Now, after the data collection, the conflict in the Amhara region of Ethiopia also started, making Metema pretty difficult to access. Besides that, only 2 days ago, the other side of Metema on the border of Sudan is called Galabat in Gadaref province. 2 days ago, Sudanese side closed the border. So it seems like from the point of data collection until now, the access and the possibility of providing services even worsened. So that's why and people could not really leave Metema towards Ethiopia, towards moving on towards Gondar, Addis Ababa, and so on, because many of the streets in the Amhara region in northern Ethiopia are closed right now due to the conflict. So that makes the situation there difficult, even though, yeah, new accommodation, medicine is needed. What I didn't mention before is that sexual work is very high in Metema. Many of the female onward migrants engage in sexual work. The HIV rates are at least 3 times higher as in the remaining Amhara region of Ethiopia, which should also be addressed with awareness-raising campaigns and with information and to address this issue. In the area, there's only one local CSO working. So we have international organizations, but only one local CSO, which in the light of the magnitude of the phenomena is not enough. And that CSO can also only support between 10 and 20 child migrants. And that's why these local CSOs should be encouraged for new to be established and the existing one to be able to extend their work. There's a best interest determination process comprising international organizations, government offices for family identification, reunification, should be also further supported, because their approach is really promising and they manage to reunify and to support stranded child migrants, but they should be supported more. And lastly, I mentioned that the areas of origin, there are some key districts, key areas where many child migrants, youth migrants come from in Ethiopia. So those really, let's say, hotspot areas could be supported by, for example, school feeding programs, or by, for example, sharing more information, or for example of returning migrants to share from their migration journey, to increase activity, to increase information and support in those hotspot areas to avoid school dropouts and migration of those people who mentioned that they don't really prefer to leave their area of origin. So I will leave it here and am available for questions. Thank you so much.
Thanks very much, Niklas, for this very timely presentation with a lot of very actual updates on the situation in Metemma. I saw Asma nodding a couple of times, so not putting you on the spot, but it would be great to hear your comments after as well. I now would like to invite Mimi from UNHCR, sorry, to give some reflections on on caregivers and maybe on unaccompanied youth, children and youth as well. Over to you.
Thank you very much. I know that it's late. A lot, sorry, I'm a bit short. A lot has been said. I don't think I have a lot to say, but I wanted just to take. Wait, well, yeah, I can put it here. Excellent. Yeah, while listening about these presentations and research that we have done, I would like, I think it will be very interesting to share with you quickly another little research that we have done on drivers of movement in Jijiga. So my idea is a little bit to move from a bigger picture of a research on drivers of movement, focusing to a smaller area, and to see how really some elements come and are repeated, right? So quickly, drivers of irregular movement in Jijiga camps. Jijiga camps is at the border, is in Ethiopia, at the border close to Somalia. So we have Somali refugees there. And actually this research, or at least this analysis was done in conversation with youth refugees that are in Jijiga camps. So one of the drivers that they mentioned is influenced by family dynamics. A lot of youth escaping from domestic violence, forced marriage, child marriage, which is the same, or seeking to help family financially. And as well, misinformation spread by diaspora. Diaspora has a major role on taking this journey of irregular migration journey for Somali, Eritreans, Sudanese, etc., etc. And we will see quickly the positive role as well that diaspora may play, and this is how my colleagues in UNHCR, through telling the real story, collaborate with diaspora in terms of awareness raising. Limited recreational spaces, and here we are talking about youth, right? Few after school programs, limited shared resources, bullying in schools, discrimination, etc. And conflicts with the host community. Limited livelihood opportunities, I think we have talked a lot, but together, right, is the strongest reason as well, where youth fall victims of traffickers and smugglers under face claim of easy employment once they would reach Europe. I think what is really interesting as well, the feeling of this personal self-agency, or feeling hopeless or useless or unable to change their destiny where they are. Uncertainty, lack of future perspective. So what is our future? Now we are here in the refugee camps, and what is going to happen to us? And obviously, very important, lack of new registration for asylum seekers, but this is quite specifically in Ethiopia. for new arrivals, right? That have, and here we're talking about legal status and access to services. I'm not saying that is not important, it's very important, but it's quite specific of the area. So this is what I wanted to share quickly, and to see how, essentially speaking, few elements or a lot of elements, they come up in different researches that we do. I know that is late. I don't want to keep you guys more. I think my quick experience that I would like to share with you comes from working with unaccompanied and separated children that were originated from Horn of Africa, and mainly Somalia, Eritrea, and Ethiopia, some Sudanese, and here we're talking before the conflict. When I was working as child protection in Niger, Niamey, through the emergency transit mechanism where UNHCR was evacuating refugees from Libya detentions, and we received quite a high number of unaccompanied separated children, with children or without children. And this is where I can bring a little bit the experience of young women caregivers of young little children. Mainly of them, they are born during the journey. Actually, the journey lasts quite few years. Here we can talk about 1, 2, 3, 4 years. As we said, they stop in the middle. Few of them, they got registered in Ethiopia camps, and then they moved to Sudan. They may register or they may not register in Sudan, and then they moved to Libya. Or we have cases that they moved from Sudan to Libya, and from Libya to Niger, and back again from Niger. They will try to continue their journey. Little children are born during the journey, and there, as we said, we can see additional vulnerabilities and needs and challenges. And here I can quickly include the lack of documentation. Birth certificate is a big issue. We have children that were moved during this journey there where they don't have birth certificate. Young women decide during the journey to enter into a relationship for protection issues, because a man will protect them, or they have no choice. They are obliged to. We have as well little children born under these forced relationships due to rape or due to sexual exploitation. And here easily we can see additional vulnerabilities. And here I will include the part of difficulties to be accepted within the family and the community of a child born through a rape or sexual exploitation. What else I can add? Definitely, as we said during the presentations, and here I'm going a little bit to unaccompanied separated children who decide to leave the country by themselves, in the sense that we have quite a big role that smugglers and traffickers play with the young boys and girls within the community. They have this capacity of communication with the young generations, with young boys and girls, and to convince them actually to start their journey. They use different channels. Smuggling and traffickers, they have different communication channels, digital and social media platforms. They are very able to understand what are the challenges and how to adapt their messages to encourage young boys and girls to leave. Very often, and recently this is what is seen, they are leaving without the consent of the parents, very often, because the the motto is live now and pay after. And then during the way, when they reach a certain point, before was, now during the conflict, they don't go through Khartoum, but mainly it was in Khartoum area or to Libya, where then the traffickers would call the family and ask for ransom and to pay for money. Young children, boys and girls, they do leave very young. I have met quite an important number of boys and girls that they have left, especially Eritrea and Somalia at the age of 13, 14, 12. And this is quite a young age to leave. They are heavily traumatized, and I think it's very comprehensible, but especially children I was dealing with in Niger, where they have gone through Libya with all the atrocities and abuses and violence that they have gone through. It was very difficult to interview them, to talk to them, to make them feel comfortable, because obviously they don't trust anyone. But as well, what I have noticed, and I'm not a psychologist, so I will not able to give a term on that, but what we have noticed working as well with other colleagues is that it's very difficult to tell about their perception of risk, assessing the risk, elaborate on the risk, and talk about it. In the lot of workshops that we have done, I have always stressed on the importance of education as a protection tool in mixed movement, because children should go to school, right? But at the same time is to see how a child that has gone through all those abuses can sit in a classroom and think of education. Okay, thank you very much. And sorry, I know it's late, but yeah, important to share some thoughts.
Thanks very much, Mimi, for your reflections. We would now like to move on quickly to the room and online if there are any questions for this third and last panel. And that's right before we move on to the final part of today, which is the keynote by Dr. Abeba. So any questions in the room for Niklas? I would like to invite you over, actually, and Mimi as well. Sarah will be online to answer any questions directed to her. Please go ahead.
Yeah, I don't know, questions, maybe more comments, but I think just a few observations from the presentations that kind of struck me as maybe worth highlighting, and kind of maybe starting with Sarah. I think the one thing, actually there's two things. So I kind of, and I think you kind of noted the oddity that a lot of parents say there's no risk, and then I'm kind of curious how much of that is I guess a bias when asking parents about the to identify that they basically fail to protect their children. So I'm kind of curious if there's a kind of way to reflect on how to get a maybe more accurate picture on that particular issue. And the other thing that struck me was that when disaggregating the data on boys and girls, the way that it was done, it wasn't quite so obvious that the kind of cumulative percentage of girls seems to be higher, actually. So there seems to be a lot more kind of risks that were sitting above 40% compared to boys. And I'm kind of curious if there's a kind of general understanding of the gender difference and whether or not girls are kind of, as a result, considered to be more at risk than boys, given that they seem to respond or do more responses in the multiple item. I presume that's kind of where it comes from. Yeah, and I think I'm gonna not take too much time and kind of leave it there. Oh, actually, sorry, the one point on but actually it's not semantics, it does matter. When talking about sexual work with children, we do consider it sexual exploitation. So it's something that I guess, yeah, it particularly for the study, it's something where to kind of differentiate children and youth when talking about transactional sex. Yeah, so I think that's just one comment, and I'll leave it there. I do have others, but maybe if nobody else, then I can come back.
Thank you, Gregor. Maybe we can take a couple other questions in the room and then we move on to answer them. Any other questions? Yes?
Thank you. It's a mix, a comment and a question. To the presentation, Sarah's presentation, I noticed that in one slide you were presenting health problems related to children, and you ask questions to caregivers, and it sounds like the Washington Group questionnaire was used for this particular topic. So my comment is I'm very glad to see that, because it's already there is a paucity of visibility for data of children. The move, in particular children with disabilities, are out of the radar. And commenting on this, I saw that if we look into the prevalence of children with disability that caregivers have with them, it's quite high, because it's about 20%. So I know that there are a lot of methodological constraints to collect disability data, particularly for children. The Washington Group short set of questions might not be the right tool to provide this evidence, but I was wondering why you were not presenting this data as disability data, if it's because of these methodological constraints or there are other reasons. Thank you.
Any more questions in the room? Not for now. Maybe we give the floor to Sarah first to address the questions.
Can you hear me well?
Yes.
Okay. So to answer the first question from Gregor, we do ask the respondents about the difficulty, the risks that the children face, and their perspectives of the risks in other locations. So when we ask, 40% of caregivers reported that the children did not have any risks on them. First of all, this is in Ethiopia. It's also important to note that the location for the interviews may also influence the answers to the questions. You see that in the data in Sudan, a lot of the caregivers reported multiple risks for their children from their perspective. So this is why it was a lot different from Sudan and Ethiopia. And also, as I mentioned, there is a lot of unreported risks because of multiple of reasons related to stigma around these risks. For example, so you see that sexual violence is not often cited or often reported in these interviews. So in regards to the second question about the health challenges, the way we ask the question is we ask the caregivers about the health challenges that their children have, but we ask it in a way to know a lot of people don't have the actual diagnosis of the health challenges that their children encounter. So we ask it as, do your children have any difficulties related to movement, for example, or to understanding or being understood. And they tell us these difficulties as the symptoms that the children have, but we don't ask about the diagnosis or the specific talent that the children are facing.
Thanks very much, Sarah. Ayla, yeah, the microphone is over there.
To add on to Gregor's question, I think a combination between asking about caregivers' own perceptions of the risks that their children are exposed to, plus asking them this more distanced question about what risks they think girl and boy children are exposed to, where we see the numbers jump up quite considerably, help us put together a bit of an understanding of something in between is probably closer to the reality. I would also point out that it is likely that the fact that they're saying that their children are experiencing fewer risks. I mean, these are children who have a caregiver in the first place. And maybe when respondents are commenting on the risks that children face more broadly, they also have unaccompanied children in mind, which we would of course expect then a higher incident rate. But your second question, I'm not sure that we answered yet, but maybe I will let the other panelists.
I think that was for Niklas.
Yes.
So it's still to be answered. Yeah, thank you. Over to you.
Yeah, thank you so much. I think it was not so much of a question, rather like a comment, and it's well noted and well taken. Of course, also, I think you mentioned that if it's children, then we would rather speak about sexual exploitation. Of course, many of the respondents were also older than 18, so we have this underage, and in this huge group we have between 18 and 23. So yeah, but your point is taken, and we will make sure to use the right terms in the final study.
Okay, any more questions, reflections, remarks from the room? Raya, yes? I don't think your microphone is on.
So because the sample has different profiles, and hence these different profiles experience different risks, I think, especially for youth traveling with children. As Sarah had presented, I presume they're exposed to grave risks, especially because they're traveling with more than 4 children. I think it's also essential for programming because they can segregate such responses in the survey in terms of protection for the caregivers, as well as the children in Sudan who are traveling with caregivers that are not their parents.
Yeah, I think no, it's well noted. I think also that's what struck my mind about that presentation, the high percentage of caregivers in Sudan who are traveling with children who are not their biological children, opposed to a very small number in Ethiopia. Daniel, I also saw your hand.
Yeah, thank you. My question is for you, Niklas. How it's more like an operational thing, I guess, on the outgoing migrants from Ethiopia to Sudan, going towards the north because of the conflicts. At DTM, we have been tracking people coming in and going out, and since the conflict began, we didn't see any leaving. And I know you mentioned that they are stranded in Metema because of the conflict, but how did you reach those ones? I'm curious about to know that. And also I have like a comment that I actually also forgot to mention during my presentation, and that I think aligns with what you also mentioned. When my colleagues were going through the literature review for the studies that they are conducting, they found out that in some cases people says that children leave the school because they want to migrate, but we actually found out, as you also comment, that they stop going to school because they don't have the financial resources to continue the studies. So that's just a comment on that. Thank you.
So my question is related to the story on the youth smuggling biscuits and soap through the Metemma Galabat border. So is there any children who are also involved in that smuggling business? And if you can, any sort of exploitative labor for children in Metemma, returnee children? Thank you.
Any further questions from the room? Yes, Gloria.
Thank you for the presentation. My question is on the Metemma qualitative study. I'm just curious because I look at the time when the study was conducted, July, August, and that was when we had the conflict from the April Sudan conflict. I'm just curious about reporting these, you're reporting about this qualitative study and the drivers and the experiences of children, but we know that the effect would have been more because of the conflict. Now, when do we tell a story when it's just about programming, when there is no conflict? Do we have such a comparison? Do we think through that? Because this is, for me, more about the impact of the Sudan conflict. And when is it when it's normal? Because these are always stranded. Yeah.
Okay, I think we can turn to answering the questions.
Yeah, thank you so much for those questions. The first question related to how did we reach the respondents? How did we sample, right? We are relying on social workers of organizations who are working in the area, and also with the local Women and Children Office of the Ethiopian government. Like they have the District Women and Children Office and the Metemma Town Women and Children Office. And we used several channels to be able to reach both Ethiopian child and youth returnees and also onward migrants. But yeah, it's right that since the conflict, the onward movements were very much reduced. And that's why we could also see that many are waiting in Metemma, and also that especially from other regions of Ethiopia, there were less Ethiopian child and youth migrants coming to Metemma and then trying to cross. So we could definitely see that reduction. Regarding smuggling of goods, yeah, there are many children and youth who are engaging in that. I think it's they do it quite voluntarily because compared to other types of jobs, it pays well. And sometimes they mentioned that it's scary because they do it during the night and then they don't go in Metemma town to Galabat using the main border crossing, but they're going through like the more rural area and then they're trying to cross the border there. And they say frequently the Sudanese soldiers or the border control catches them and then they just have to pay them a share of their profit. So it seems like they were quite happy about the opportunity doing it because it pays better than other job opportunities they would have in Metemma town, but still it was by some described as a bit scary. And I think that was your question, right? Okay. And then regarding the timing, yes, of course, the conflict in Sudan was a big change, and then triggering a lot of return of Ethiopian migrants in Sudan returning to Ethiopia. Of course, also refugees coming. But I would say the findings that we got from this data collection, from this study, are not only valid for this specific moment, but also have some greater implications because people were describing, first of all, what were the reasons when they left their hometowns at the first place. So that's rather related to migration drivers, to aspirations, to intentions. We also learned a lot about their migration journey, how they get to Metema, how from there they're trying to go on. So all of these things are not only bound to the specific context of conflict in Sudan. And also, I think it still shows us the kind of needs returnees have, Ethiopian youth and child returnees have in Metema, the type of needs onward migrants have in Metema, and this kind of recommendations that we get out of that, most of them would be also valid in a more normal situation, I would say. And of course, the whole motivation of this this qualitative study started before the conflict in Sudan started. So the idea of having this qualitative study was even there before the conflict in Sudan started, because of many children being stranded there. So it's not only because of the conflict that children get stranded, but even way before, and that was the very motivation for having this study as well, that for different reasons in this transit point Metema, Ethiopian youth and child migrants are getting stranded before going on or before returning, and that was the case before the conflict in Sudan started.
Thank you, Niklas. If I may add something here, since we collaborated together on this study, I think we also went to great lengths to make sure that the sample was varied. So with Niklas' research team interviewing both returnees as well as stranded migrants, and I think from your data, we can see that the sample of children and youth that were already stranded in Metema before the conflict started. So the study would still include even perceptions and experiences pre-conflict, right?
Yep.
Yeah. Okay. Online question. I just got a note. Has the question been shared? Oh, it's on the other side. Okay. Thank you, Liv. Sorry. For Sarah, Sarah mentioned insults as part of risks freed by children and part of drivers of movement. These insults, are they between children or adults and children? So like if children are receiving insults, is that from other children or from adults? Then to what extent can these insults be considered high-level risks compared to physical violence? And are insults not also considered as what constitutes harassment? So there's a couple of questions in one. Over to you, Sarah.
Thank you, Jim. So we ask, so for these questions, we don't directly interview the children. As mentioned, we ask the caregivers about the type of risks that are perceived. Insults were cited very heavily on the study, but we didn't specifically ask about the perpetrators for these insults, whether there were adults or other children. And I would say that insults are definitely a great risk to children because it also entails a lot of social problems and social issues that the children go through in the countries that the children on the move go through. We ask about insults. We ask the question, and then insults are different from harassments because insults insults can be related to a lot of other factors, such as xenophobia, such as the children not being very integrated in the society, while harassment is harassment with all its different types is much more targeted to the children.
Thank you, Sarah. I think if there is, I'm looking at the time, if there are no further questions from the room or online, I suggest we move over to the final part of today, which is the keynote from Dr. Abeba. I'll invite you to come over here. And another applause to the speakers of panel 3, sorry.
No, I don't know, just the one like this. Thank you, everyone. It's really a privilege to be a keynote speaker in this relatively small number, but very focused and diverse and knowledgeable group of people who have been, discussing a lot of extremely important issues about child and youth mobility with the drivers, with the protection risks, and with the experiences of caregivers. So I'm so humbled to be a keynote speaker at this juncture on a very important issue of interest globally, but more important to this part of the world, the Horn in East Africa, which is so volatile and impacted by instability, climate change, conflict, and a number of challenges. So I would like to thank Ayla for this opportunity. And in fact, the entire MMC team, DRC, I think that's the one who has given us all this support, and thank you. Thank you for the Switzerland government for the support for Save the Children, which is a partner. With that remark, from the outset, I have to admit that whatever I speak is largely to be informed by my understanding and research in Ethiopian context, and very limited on the Eastern Horn of Africa, and very, very limited on Sudan. And in front of us, it could be, for me, kind of being difficult to speak about the situation in Sudan because I have limited understanding. And so whatever I speak, you have to understand it with this context. I think I prefer to begin with kind of my personal experience as a young man of age 14. And that is 32 years ago. I was attending school in my town, district town, shuttling 3 hours per week and carrying my food on my back. And I'm not physically strong, and thus I feel that education is my only way out of poverty. So 32 years ago, the war between the TPLF, the later EPRDF regime, and the Derg was going on, and this, when the war escalated, the school was terminated. And what option do I have? I totally believe in my mind that I'm not going to be a good farmer. I know that very well. And therefore, my option is to move. I don't articulate it as a kind of internal migration or urban migration or whatever. Just I have to move out of that local rural area and go to Bahir Dar, which is the regional city of Amara region, and make some money for my future education. And then I begin to do petty trade, getting support from family, and I was selling banana and sugar cane and orange when the school was interrupted for half a year. So next year, I was not offered education opportunity in Bahir Dar, rather in a different town, that's Warrata, between Gondar and Bahir Dar, and I have to move there. And this time, it's only the money that I made in those 6 months that was able to support my education. And then after 6 months, again, for the second round, it was interrupted. And I was determined that my education is now gone. But I got, fortunately, the free promotion opportunity. And when I got that, I joined the school back. And this is not for flattering, but I was the only to pass for a degree program from 170 students. So if I was not to move to Bahar Dar, you wouldn't find me here, and I wouldn't have been talking to you here, and my life could be completely different. So when we speak about immigration, we need to see the challenges as well as, the aspirations that young people have. And the challenge that I often observe is, well, I completely understand that different agencies have different specializations in concerns. So if you are from UNHCR, you are worried about refugees facing so many challenges. If you are from IOM, you may be, working for labor migration, saying safe migration, whatever. If you are from World Bank, you will be more interested in development and connect migration to development. So migration is really a globally game changer, to my understanding. In terms of politics, I will not go into what Trump was saying some years ago, building a wall between Mexico and the US. If that wall is fully built and if the Mexicans are stopped from entering, I could imagine what the US economy would look like. I have been 6 months once and 4 months once in the United States, and the Mexicans are one of the hardworking people who have supported the construction sector in the United States. And I wanted to be frank with you, most nations who are anti-migration are not genuinely anti-migration. They are rather being selective, and they want to pick the crumbs and do not want to give the vulnerable ones an opportunity to develop their skills. So my understanding about migration is when it is well managed and when it is well organized and safe, we can reap a lot of fruits, both for young people, for adults, for sending communities, for host communities, in terms of remittance, in terms of skill transfer, in terms of knowledge, and in a number of ways. On the other hand, when it's poorly handled, you see a lot of challenges and problems that people face, not only for young people and children who are vulnerable because of their age, maturity, not undermining their agencies and capacities, but as a person from psychology, I understand developmental issues in decision making, in which their aspirations sometimes may override their rational decisions. But when it is poorly managed, even for adults and for many people, it's a big challenge. So with this general context in which over 280 million people are international migrants and nearly 750 million internal migrants, or close to 1 billion people moving, I think I do believe that we are created to move. The issue is on how we move and how protected we are in our move. So in this general landscape, the Eastern Horn of Africa is a bit characterized by being a region on the move. Some writers, consider it as a region on the move. As said at the beginning, owing to conflict, owing to aspirations, owing to disparities between, economic disparities in origin and host countries. And in fact, the mobility is within largely. It's intra-region than, inter-region or cross-region issues. Although I understand research from the north that are very concerned, or agencies from the north that are very concerned with a lot of migration of Africans and with their plight in the Mediterranean. I strongly do feel that much of the migration is within the region. So Eastern Horn of Africa, despite that it only constitutes 5% of the world's population, it constitutes 14% of the migrants and largely the forcibly displaced people. The two countries in context in which we are speaking about, Ethiopia and Sudan, constitute the largest share, even by African measures. They have over 10 million forcibly displaced people. You know, the figures in Sudan show from 5 to 6 million, in Ethiopia 4.5 million, and the conflict is still ongoing in Sudan, ongoing in Ethiopia. I don't know why people did not give much attention to the war in Amhara region now. That's one of the third biggest, the second largest region, constituting 1/3 of Ethiopian population. And what is going on there? And I don't know what the outcome would be after a few months. Currently, it seems that people are not able to move and are stuck, or they are moving little from their village and come back when the military leaves or when the fighting groups leave. So that would even further escalate the situation of young people moving in this region and in the two countries particularly. Coming to the three major issues that we have raised today, the motivations and drivers, including onward move, the protection risks, and the unique experiences of caregivers who are supporting children and young people. I think one thing I have to speak is that I don't claim to have captured what was transpiring from the 8 panelist speakers and from also program organizers, including Ayla and Rita. So many people were raising a lot of issues, and it would be unfair for me to pretend that I have, hey guys, I have captured all your points and here is the list, 1, 2, 3, 4. I cannot do that. So the only thing that I would do is raise some issues that came to my mind from your communication. That's what I can do. So coming to the drivers, well, young people could move for various reasons. Well, partly could be they are accompanying their family or their parents who are moving. Partly could be that is the only choice remaining for them. Partly could be that is the best choice, as it was for me. So there could be diverse reasons for their move, and you have also well anchored that point in your communications. And in fact, the war, the climate change, the conscription, the lack of freedom, all that have their own contributions. And apart from that, the desire to change their lives also contributes. So I think we cannot silo, or we cannot give one reason, one best reason to explain. Partly, as you have read, it differs from country to country. It differs across, in terms of gender. It differs for various contexts, and even the kind of move you did for forcibly displaced people. That's a choice they have to, save their lives. It's a matter of survival. That's what you may have seen from the perspective of Eritreans. They first just want to skip that conscription, and then they need to plan next after they are in the second country. When there is intense fighting, it's a matter of survival, and you have to leave it. When poverty presses you, or when, from a nuclear perspective, when a slow onset climate change, challenges you, and when the poverty exacerbates, then you have to skip it. So the various contexts of migration are fed by various drivers. That's what I can say. So it could be violence, insecurity, climate change, desire to change. So various accounts. What I can only say and what I learned from what was shared or what has transpired is that the drivers are multifaceted. The drivers are complex. The drivers are layered and at times fluid. So we should not, we could see priorities. We could see the most pressing reasons. That's fine, but we should not. But my mobile would tell me something different than what is said. Okay, it was about timing. Ella, I have already, the alarm, and it was not saying 5 minutes remaining, but I can do fast. So unique experiences are there. What attracted my attention was the huge change in the pre-post conflict service needs of Sudanese youths who were interviewed. I think going to the research needs or the research gaps in what we need to do, here are a few that I try to identify from our discussions in here and from my readings and experiences. Well, partly it's informed by my various consultation research for various entities. It could be partly informed by my academic publications on migration issues. And partly I'm leading a center for forced displacement and migration studies. Based on that, I would reflect a few of the gaps that I noticed in research interests. First, a positive lens is less focused to my understanding. There is a general tendency to focus on abuse and exploitation. It is there, and we need to give it the proper space. But our interest should not be, merely reducing risks. It should also be, enhancing opportunities for people. Otherwise, you can scare me by saying when people are internally moving, well, if I happen to move, I could have been one of the farmers and contributed to, you could say rural communities are moving and the agriculture is being harmed or whatever. Well, people make decisions. They choose what is better for them. So we should not simply lament about the abuses and exploitations. We need also to consider what opportunities, what decisions, what aspirations are young people hoping for. And even sometimes we need also to problematize about immobility. Immobility is also a big risk. You have to be able to move, not only to change your lives for the better, but also to survive, as mentioned earlier. And often I notice a kind of crisis-oriented interventions than development orientations. This is one of the areas that we may need to focus. What development can be, what development focus can be included. The other is in terms of target group. To me, IDPs are forgotten. Often we have relatively better study, a lot remaining on refugees, relatively better study on international labor migration. But IDP seems an area that is so gray and not addressed. Partly that's because, well, I'm not quite sure if IOM is the appropriate. I didn't know. It's just I didn't know. I'm not saying no. This is your area. For refugee, I'm very clear that UNHCR is more referred. Although we cannot say this is your area, this is not your area. Territoriality is not what I am asking for, but mandate is very important. So for international migration, IOM is doing a lot. For example, on a return migration, I've been researching on reintegration, and IOM is doing a good job. But
For IDPs, I'm not quite sure who is the most responsible entity. And the international community is not also much interested in it. Partly I understand, because these folks will not be much of the burden. They feel the international migration and the refugee is much a burden. The third research issue is kind of lack of collaboration among different groups and entities. I think I can give a simple example. In Africa, there are various policies that are developed at the AU level, at regional level, the East African Community, IGAD, COMESA, or whichever regional economic community you may raise. There's a kind of collaborative work is missing. Even it is now that Nicholas is going to connect me with KIMS, Kenya Institute of Migration Studies. We have one research center at Addis Ababa University. We have another research center here in Nairobi, very close, people, 1.5 hour flight, but we are not, getting connected. So getting connected among various entities is another issue that I call for. The research landscape and the methodology issues, I think I'm worried about statistics. I'm not able to catch up with those fluctuating statistics. Partly it's because the situation in the ground is changing. As we have seen within, half a year, we have the war in Sudan, we have the war in Ethiopia, we have the war in Gaza. So that makes the number to shift every time. And partly it's because different interest groups, give different figures. I heard 1.2 billion people will be displaced till 2050 forcibly displaced, owing to climate change and climate and environmental change only. 1.2 billion people. So that will be more than 1/10. The estimate is 10 billion by 2050. So 10% will be forcibly displaced by climate change. And we need to focus on climate change, but I don't think that scaring is a good tactic of getting attention. So sometimes we need to be curious about figures being provided. When I began while I was doing my dissertation, it's on the experience of trafficking returning women from the Gulf states, Ethiopian trafficking returning women from the Gulf states. One of the challenges for me is I found first 800,000 people are now living a traffic life. When I read another article, it says 2 million. The other says 4 million. Wait a minute. How am I going to, reconcile these figures? And who is leading these figures? So a critical look into the data, into the statistics, and even in the qualitative research, into the quality of interviews. You guys were raising a very appropriate question on how are caregivers articulating about the risks that young people are experiencing. Well, we need to avoid, from a UNICEF perspective, sometimes we need to avoid sensitive questions to children. But sometimes when we try to get this from others, I think there will be, well, I partly claim as a qualitative researcher. And that's what I'm teaching, and this is telling me the exact time. I'm teaching qualitative research for PhD different group of students. And I tell them that the problem with this one is it will insist telling me it's done. Thank you. Even qualitative data has to be seen very critically. Well, the other issue that we need to see is, I'm sure I will be done in 5 minutes, has to be critically seen as sometimes some interventions may have negative outcomes. For example, because we are worried that children are being vulnerable in the cities and towns, we may be interested in intercepting them and sending them back home. if we call it sometimes home, because that very home may be the very reason for their move, because partly it hasn't given, that's a mild point is because it hasn't given them their aspirations, but a more worse is it could be one of the most abusive and difficult situation to live for them. So some intervention, for example, from the so-called durable solutions. One is local integration. There's a lot of myths related to local reintegration. A good example is what's going on in Gambia and Ethiopia, between the Nuer and the Anuak related to local reintegration. The Anuak would be nervous if you speak that term now as CRRF. Comprehensive Response Framework. They don't like it because they consider it as a means of undermining their agency within the region. So our interventions should be always cautious that they don't backfire and do more harm than benefit. The impact of the ongoing war, this is a repetition, in Sudan and in Ethiopia, in Amara region, has to be further examined. While my worry is what kind of methodology are we going to use in crisis situations, and I leave this for you guys as researchers. And finally, the presence of various actors playing underground hasn't come much in our discussion today. We have raised a lot of very interesting and wonderful ideas, and I'm really extremely happy that I was part of this engagement. But there were some issues that were left, like traffickers, smugglers, their role, and even at times of states, sometimes taking it as business. Some states are, they are level brokerage. You were raising, who was raising Ethiopia is going to send 500,000 young women for domestic work, while we are crying the deportation of, 100,000 after 100,000, 700,000, in the last 5 years alone. And it's like filling the jar, the broken jar, fill the water, and then it's coming, and then you fill it again. So that vicious circle. Overall, I'm really very happy with all the deliberations. And I think the East Africa Migration Route Project has done very meaningful evidence base to use for intervention as it refers to children, youth, and their caregivers. So thank you, Ayla, again for this opportunity. Thank you, everyone, for listening. Thank you.
So you said that you were not going to capture all the points from the entire day, but somehow I think you managed, actually. You set our expectations low and then you completely exceeded them. I realize that we're a little bit over time. It's been a really packed day in terms of content. So I think the best thing that we will do is transition right to our reception and really take forward the conversation there, because I think there's so much to pick up on. So just with a minute or two of final remarks from me, I really want to once again acknowledge that this has been really the culmination of nearly 2 years and several conflicts. of research and evidence that's all really coming to fruition now. You've got QR codes in the program that point you to 2 of the publications linked to this research. You've got 2 more snapshots on the way. You've got the Mitema study that Niklas presented also on the way before the end of the year. And for anyone who wants access to the dashboard, please let us know. We can also do small trainings so that you can get really familiar with the data. It's really important that we share it as much as possible. What's next for us and this? I think all of these insights are going to be taken forward into our thinking about what's next with our discussions with SAFE for the next year, because the East Africa Migration Routes project is not coming to an end, only the first phase of it. So that's important to say. Please stay tuned. And you'll notice we've had wonderful people around taking video and audio. Some of you have been generous enough to have one-on-one conversations with them on camera. And we want to make a kind of a capsule of this research event in a video format so that people can tune in and really hear some of the crucial insights and put that online rather than just reading a typical conference report. So you'll stay tuned. Please stay tuned for that. A word of thanks. First and foremost, I really want to thank the MMC team that has really been behind the scenes making all of this work. Could I ask you all to stand up? I know it's a little bit embarrassing. And some people might be outside, but I mean, special shout out to Olive, to Dennis, Lavina, Rauya, Jim, Joseph, Dedese. I mean, without whom this event would not have been possible. This is actually their initiative. And we also have our colleagues online. Sarah, of course, you haven't seen our colleague Theo, but he's also been helping us in the background. G, also, you didn't stand up and you should have, who's working with us for the next several months. So a huge thank you to acknowledge all the work that you've done. Save, you guys turned out in full force, extending your trips, flying in. We really appreciate this collaboration, and your feedback has been invaluable, both at the learning event, but also here. And let's keep the conversation going, especially as all of these products come out and we start getting to the really interesting conversations around what can be done with the findings. And then finally, I don't know if we still have our colleagues from the Swiss Development or the Swiss Agency for Development and Cooperation still online, but a huge thanks. I really want to emphasize the fact that multi-year funding in our space to be able to do long-term data collection and research, much less programming, is extremely rare, much less to be able to really plan something that's adaptable, that we can change as we see needs evolve along the route. And that's exactly what the Ethiopia Migration Routes program is supporting us to do. So I can't underscore enough how unique that is. And when we have conversations about quality funding, this is exactly what we are talking about. So a huge thanks to them. And thanks to everyone who's tuned in online and sticking with us for all of the day. With that, I will end the conference and say thanks to all of you in the room. The participation has been absolutely terrific in terms of how active everyone has been in posing questions and sharing their own experiences. So let's keep it going next door, through the blue door, during the cocktail session. Thank you.